I think, we check to make sure that all board members have the exhibits that have been sent out. And it appears everyone does have that. And the times for the rest of the, tomorrow, Wednesday, and Thursday are Mr. Henry?
I believe you have a convocation from 9:30 to 10 tomorrow.
Yeah, well, 9-ish to 9:45, so 10 tomorrow, and 9 on Thursday. Is that what everyone else understood? Is everyone still able to do those times?
And can you confirm that we'll be ending no later than 5?
Yep, just like 2 times over.
Yes.
Yep, it looks great.
You gotta mute one, something. Oh, that's on yours. That's
Barring some absolutely unforeseen consequence, I would say that yes, we would be. So if there's no other housekeeping, there are no other housekeeping matters to deal with, we can get started.
What should I be checking on?
And we can start with the roll call. Mr. Escovitz?
Present.
Mr. Hahn?
Present.
Mr. Devereaux?
Present.
Mr. Webb?
Present.
And I am Carol Goins, I am present too. So again, good morning to all of our litigants. We have Mr. John Maddox for the city and Mr. Lakota Denton for the claimants. Good morning. And I believe that traditionally the city has gone first. If there's no objections to that, Mr. Maddox, if you would like to make an opening statement, feel free, or we can just go into the city's evidence.
I do have an opening. However, as a preliminary matter, I would like to ask the board, as a matter of procedure, the city and the grievance in this case have entered into stipulations with respect to procedure and evidence. And if Mr. Denton has no objection, I'd ask that the board take judicial notice of those stipulations at this point.
Put yours down a minute.
I believe you're on mute.
We were on mute.
I think Lakota is on mute. I cannot hear you.
Mr. Denton, is there any objection to the board taking judicial notice of the stipulation agreement?
I'm sorry, I cannot hear Mr. Denton.
I cannot either.
It looks like he's having some technical issues. Mr. Denton, you may want to check your settings. If you look at the bottom of the screen, you'll see 3 dots in a row. That should bring up a list that includes settings and troubleshooting. There may be an issue with your microphone setting. We can hear you.
Can you hear me now?
Yes.
Yes.
Thank you, Mr. I need to back up a little bit because no one was able to hear me, and I apologize for that. First of all, just a question, Ms. Goins. I'm used to addressing Your Honor and Judge. How would you like me to address you during this hearing?
I think the appropriate way is to, I'm the chair of the board.
Okay, so Madam Chair, does that work?
That's fine.
My expert witness has been scheduled to testify tomorrow morning at 9 Eastern. We scheduled this many weeks ago, and I want to make sure that that's going to still work. That's the only time that he's available.
What do I need to keep an eye on to make sure
Just
things are still
a
good?
second.
Yeah, that was, we were trying to get it live before.
Mr. Denton, I did have a matter that was scheduled for hearing tomorrow, but I believe that it is been resolved, and so I am able now to be here at 9 and start, is provided everyone else now can be tomorrow at 9. Any of the board members, I'm here, I see a thumbs up,
Okay,
so it
thank you.
looks like tomorrow at 9.
Thank you, Madam Chair. And then with respect to the stipulations, I have no objection to entering those into evidence.
So great, with those in hand, then I believe that's the only preliminary matter we have
Make sure it's
right
always
now,
Just check the
and we
phone.
are ready to see what the opening.
But usually once we're connected, unless something funky happens, it's usually pretty.
Mr. Maddox, if you would please, I have got the volume on the app, and the TV we're on to the maximum, but you're still a little bit quiet, so if you would, just try to project some.
I will use my best from the diaphragm voice. Madam Chair, members of the board, in August of 2021, in an effort to limit the spread of COVID-19 among its workforce and to limit the harm caused by COVID-19, the city of Asheville, like many large employers, put in place a policy requiring its employees to provide either proof of a vaccination or on a weekly basis, proof of a negative COVID-19 test. The policy was very clear. Employees who failed to meet those requirements would receive a written warning. If they were found to be out of compliance a second time, they would receive a 5-day suspension without pay and a final written warning. And if they failed to comply a third time, they would be terminated. The vast majority of the city's more than 1,400 employees complied with this policy without issue. And to this day, the city has employees who are not vaccinated, but every week provide the results of a negative test without issue. There were, however, at least 5 city employees who refused or were unable to provide proof of vaccination and who refused to be tested and were accordingly fired. They all come from different departments, but they requested an appeal before this board as a group, and the city agreed to that, provided that we entered into certain stipulations which are now properly before this board. When an employee appeals a termination to this board, the city is charged with proving the decision to terminate was justified. Further, per this board's substantive rules, a termination is per se justified if 1, an employee violated a city or departmental rule or policy, and 2, the employee received due process. Now, ordinarily, this is the part of an opening where I would provide a forecast of the witnesses and the evidence that the city will present in order to demonstrate that the action is justified. In this case, however, that question has already been answered before we ever open the hearing. Before this hearing ever began, these former employees, through their counsel, stipulated that 1, these former employees insubordinately and willfully violated city policy. That appears in the stipulations. Second of all, they also stipulated that they received due process. They received all the pre-disciplinary hearings. They received their right to appeal to the city manager. They received all due process. They had already said as such. As such, under this board's rules, the city's actions have already been justified. A decision to terminate is per se justified if an employee violates a policy and receives due process. Given that, this case is already decided and the board should decide in the city's favor, even if it decided not to present another witness or any other piece of evidence. The city is, however, out of an abundance of caution, going to present 2 witnesses in support of its decision to terminate these employees. The first, Stacey Saunders, is the Buncombe County Health Director. Ms. Saunders will testify in the capacity of an expert in the field of public health and will provide information about the dangers posed by COVID-19, why vaccines are a safe and effective tool for preventing the spread of viral diseases such as COVID-19, and about the efficacy of COVID-19 testing as a means of limiting spread. The city's second witness, Ms. Shannon Barrett, is the city's HR director. Ms. Barrett will provide the board with context and information about this specific policy and how it is carried out and enforced. Her testimony will demonstrate that the city, faced with data showing rising cases in the community and real fear from employees about returning to work alongside unvaccinated and untested coworkers, decided on a policy that recognizes vaccination as the best means for preventing infection spread, but that also provides an option to employees who could not or would not be vaccinated. Last summer, with the Delta variant surging and with resources strained almost to the breaking point, the city decided this policy was necessary to keep the public and its workers safe. In doing so, it rejected a flat vaccine mandate in favor of a policy that affords its workers with protection, but allows differences of opinion with respect to vaccines. The employees before this board, however, do not think that they should have to follow any policy of this nature, and that they are free to substitute their own judgment from that of the city manager, even in matters touching on safety. This board categorically rejected such an argument when it passed its substantive rules, and I am confident that it will do so again at the close of the city's evidence. Thank you.
Are you ready to proceed with your evidence, Mr. Maddox?
Yes, ma'am.
I'm sorry, I guess Mr. Denton, you will do your opening statement.
Thank you, Madam Chair. Very briefly, thank you for everyone for participating. Again, Lakota Denton, and I represent 5 city employees. Mr. Aldridge was a City of Asheville firefighter. Danny Walton was City of Asheville Parks and Rec. Bobby Crane, City of Asheville Parks and Rec. Wesley Hubble, City of Asheville Sanitation. And Chelsea Wells, Asheville Police Department. Part of the due process required for my clients includes this hearing. And so I appreciate and I respect that they are having time to be heard and that we are allowed to ask questions and give a response to what happened to them. And I think really the only forecast of testimony that I would like to share is that I think you're going to find there's a major disagreement inherent in what you're going to hear today. And that disagreement comes from whether or not vaccines prevent the spread of COVID. So I ask everyone on the board to listen carefully to data that supports that statement. Thank you.
Thank you, Mr. Denton. Mr. Maddox, are you ready to present your evidence?
I am. And as our first witness, the city would like to call Ms. Stacey Saunders. Madam Chair, Mr. Henning, how are we handling swearing in witnesses?
Madam Board Chair, just asking that very same question, Mr. Maddox. I had not thought to make any special provisions because I know we have done that through the city clerk's office in the past when we had the swearing in of our other board members. So I think we need it to have happened. We need sworn. I'm assuming both parties want, the board wants this to be sworn testimony. I guess I was operating under the assumption that you could provide that through the clerk's office as we have in the past. Can the city provide that?
Sarah.
Give me 1 moment.
And while you all look into that, Mr. Maddox, I'm happy to stipulate that Ms. Saunders is an expert in the field of public health that helps expedite the questions and makes it a little quicker for everyone, if you wish.
I appreciate that, although I would like to give the board an idea of Ms. Saunders' qualifications. Maybe we just skip the part where we ask the board certified as such, given that you're stipulating to it.
And Mr. Maddox and Mr. Dent, let me ask you both, in case there is some difficulty in having someone from the clerk's office provide an oath. I am a notary and so authorized to administer oaths, and I don't mind to wing that, but I feel better if somebody who's used to administering them. And I know there's a little bit different procedure when you're not in person and you're online.
I've seen if she.
If it's possible to have somebody, not too much trouble for city administration to provide them, I think that's best, but I'm at your disposal if that's gonna be problematic.
Well, I'm just, if it's your preference, I'm just up the hall from the city clerk's office. I can walk down and see if Ms. Burleson is available, if that would be helpful.
It would make me the most comfortable to have somebody who's administered an online oath before doing it.
I'll be right back.
Okay.
I think they're working on it, don't worry about it. No. It might be right there where your foot is.
I got it.
I was just trying to call you. Can you do the oath? You what? Can you do the oath? No.
Can you do it? Oh, he went to go get Maggie anyway, so
Oh,
just
no,
let them deal with
Okay.
that.
But it still sounded kind of echoey. Let's try.
You want me to unplug the,
This microphone is throwing us off, I think.
Okay.
I believe, where is it plugged in?
in the back right there? It's just,
Oh, right here, I see it.
Okay, I just spoke to Ms. Burleson, and I'm going to send her a link to the meeting right now, and she will log in to swear in witnesses.
Ms. Burleson, are you with us?
Yes, I am. Thank you for the invite.
Thank you for taking time out to join us. Mr. Maddox has a witness that he would like you to administer the oath to so she can testify.
That'd be just fine. I need to know who she is, and I need to see some ID, please.
Sure. The city's introduced Miss Stacy Saunders, and it looks like she's looking for her ID right now.
Thank
And
you.
quick question, since I'm also supposed to be testifying, should I go ahead and be sworn in too while we have Ms. Burleson so we don't tie her up?
That's a good idea.
That's a great idea.
Ms. Burleson, is that enough just to show that to you?
It is. That's fine. And Shannon, I know you, so you don't need to show anything. For Ms. Saunders and Ms. Barrett, do you solemnly swear and affirm that the evidence you give to the Civil Service Board in the case to be heard shall be the truth, the whole truth, and nothing but the truth?
I do. I do.
Thank you.
Thank you, Ms. Burleson. We appreciate your time.
Thank you,
Thank
Maggie.
you. Mr. Maddox, when you have another one, just let me know
Thank
if
you.
you have any others.
All right, this is an adventure. So, Ms. Saunders, thank you so much for being here today. Would you please, for the board, state your name?
Thank you. My name is Stacy Turpin Saunders, Saunders.
And Ms. Saunders, where do you work?
I work for Buncombe County Health and Human Services as the local public health director.
And how long have you been the health director in Buncombe County?
In Buncombe County, I began in August of 2020.
And where did you work prior to that?
Prior to coming to Buncombe County, I was the health director in Alamance County and had been in Alamance County working in the health department since 2007.
And what type of experience did you have prior to becoming a director of public health?
So prior to coming to Buncombe County, I was the health director in Alamance beginning in 2014. Prior to becoming the health director in Alamance, I was the health education supervisor in PIO. Prior to that, worked at Alamance County Health Department as a human service planner evaluator, particularly around grants and program implementation and operation, and have also worked at a regional level for a nonprofit, the March of Dimes, as a regional triad coordinator.
And where did you attend school?
Undergraduate degree was from Radford University in medical technology with a minor in chemistry, and also received certification from the Wake Forest University Baptist Medical School in medical technology, and then went on to receive a master's in public health from Johns Hopkins Bloomberg School of Public Health.
And so is it fair to say that your specialty is now the field of public health?
Yes, my discipline and my focus is public health practice.
And what are some of the duties of the Buncombe County Health Director?
Any local health director in North Carolina has duties that are defined mostly in North Carolina General Statute 130A-41. In general, in a very general sense, the duties of a health director are to prevent disease, prevent health hazards, protect the community's health, and promote opportunities of health. More specifically, that is the administration of public health programs within a health department and in the community. It also includes investigation of communicable diseases, cases and outbreaks. It includes investigation of diseases, regardless of communicable disease, that they're a communicable disease in nature. It also includes duties to enforce public health law at a federal, state, and local levels. And also one of the duties of a local health director is to disseminate information about public health issues to the community, but also leaders. And
you mentioned there that disease prevention and control is among your duties. Does that include, well, since 2020, has that included COVID-19?
Correct, it has. COVID-19 is a reportable disease, and it is my job to investigate COVID-19 as part of that.
And does that involve tracking, for instance, the spread of COVID-19 in the community?
Correct. That involves surveillance, monitoring, tracking, and informing the public about information regarding COVID-19.
And do you believe your testimony will be helpful to the board to understand the facts of this case?
I believe so, as it relates to public health practice.
And now, Madam Chair, at this time, I would like to tender this witness as an expert in the field of public health, and I do believe that Mr. Denton, as he previously indicated, would have no objection to that.
Mr. Denton, do you still stipulate?
Yeah, no objection.
She will be taken as an expert in the area of public health. Thank you.
Thank you. So, Ms. Saunders, I'd like to start out, I guess, talking about COVID-19 generally. Could you tell me a little bit about the virus and what kind of an effect it has on a person?
So in general, just to, I guess, lay the foundation that COVID-19 is the disease state that we've all come to know, but COVID-19 is caused by what we first learned was a novel coronavirus, SARS-CoV-2. And what we know about it is that it's a primarily respiratory illness that is transmitted from person to person through respiratory droplets that, as we interact with each other, can be spread from person to person through sneezing, coughing, talking, singing, shouting, those types of things, that any of that type of exchange. We also know that those droplets can move from one person to another, and if our mucous membrane types of spaces like our eyes, our nose, our mouth then come in contact with it, we may be able to be contract the virus that way as well. And then also through contaminated surfaces, that if we have the virus on our hands, if we touch surfaces that might have virus, or our hands have the virus on them from other activity, and then we touch our eyes, nose, and mouth, we could potentially get infected that way as well. In general, COVID-19 can affect anyone, and all ages have been impacted. What we do know is that those at higher risk for severe illness tend to be those who are older, 65 and above, or anyone of any age with any underlying health condition that tends to have that. Those two groups tend to have higher risk of severe illness with COVID-19.
So you talked a little bit about how COVID-19 spreads, and is close contact a component of that?
It is. We determine, when we are doing case investigation, one portion of that is the contact tracing piece, and the exposure is very dependent on duration and proximity. So for us, as public health professionals, when we think about the exposure, it's about how long were we in a certain space with others who were infected. And typically that's been within the 6 feet for a duration of 15 minutes or longer, that puts us at higher risk of exposure and contraction.
So persons, for instance, riding in a vehicle together, that would maybe be a place where there's a high likelihood of transmission.
That is correct, based on duration. So places like indoor public spaces where social distancing can't take place as effectively, are at higher risk. Vehicles, so when folks are traveling together in vehicles and can't keep 6 feet and are in that space together for more than 15 minutes, those are spaces where there's higher risk.
And from a public health perspective, what kinds of control measures are helpful in preventing the spread of COVID? I know you mentioned social distancing, but what are other measures that are helpful?
Right. So as the COVID pandemic and the response has evolved over time, in the early days, we really did have our very basic public health control measures around, keeping distance, washing our hands, the use of face covering, that when we cover our nose and mouth, that helps us stop the spread of some of those respiratory particles. And that as time has gone on and as the response has evolved, other tools have come about, one being vaccine. And, vaccine for decades now has been a leading public health tool for mitigation of disease. And in addition to vaccine, then testing. Testing is used as a tool for public health to quickly identify as possible any positive or infected individuals so that we can then also stop the spread by identifying any of the folks who have been in close contact with that individual and stopping that chain of viral reaction.
So I'd like to take a few of those in turn. I'd like to start with talking about vaccination. So you mentioned vaccination, and generally, not even focusing on COVID-19, how important are vaccines to preventing the spread of viral diseases?
And you're referring just in general.
Yes.
So in general, as I mentioned, vaccine for decades has been a key public health tool in reducing morbidity and mortality of communicable or vaccine preventable diseases. For decades now, we've had vaccine available for many diseases and have seen the impact of vaccine on reducing that burden of disease and burden of death in a number of those diseases. What comes to mind is measles for one, where prior to the licensure of a vaccine, we in the U.S. were seeing 500,000 cases of measles prior to that vaccine being available. And then in the years subsequent to that, and now decades later, when we look at measles, we see last year, I believe it was 50. So again, just the impact of vaccine as a public health priority tool to help reduce the burden of disease and the burden of death. I can't say enough that vaccine is seen as one of the greatest public health achievements of the last 100 or so years, and that rises to the same level. Vaccines rise to the same level of public health achievement as improving mother and child birth outcomes and even motor vehicle safety.
So turning more specifically to COVID-19, you said in early days, we had only basic control measures, but did that change at some point during the course of the pandemic?
It did. So early in 2020, when we were first being introduced to COVID-19, we did not have a vaccine available. And so we did rely very heavily on our sort of what I call, public health 101 and basic public health measures of keeping distance between you and another person so that we reduce the spread. Also limiting our interaction, meaning if you can't keep 6 feet apart, then we want to make sure that you're limiting the duration that you are with other folks and being mindful of that. Because the longer you're in a smaller space or in closer proximity with someone, the longer that you're with that person in that closer space, the higher the risk. And then, of course, as always, hand washing. I can't say enough about that one either, that is tried and true public health. And in any situation, that hand washing not only helps prevent the spread of COVID, it helps prevent the spread of many pathogens. And so those were many of the tools that we relied on in the beginning. And, just a lot of public education around being mindful of your settings, being mindful of your interactions. Whenever possible, choose outdoor spaces, because outdoor spaces show less of a risk. There's more space for folks to move around. There's naturally more air circulation in an outdoor space. And then as we closed out 2020, that's when we began to see vaccine be available in community. It was at the end of December of 2020 when we had a vaccine that was authorized for use and could begin vaccinating our populations.
And those vaccines, the first of which became available in late December of 2020, were those approved by the FDA?
So the FDA first used the emergency use authorization process to authorize those vaccines for use. And then we were able to begin administration of the vaccines once the vaccines went through the entire process of receiving the emergency use authorization based on data. And then the advisory committee on immunization practices, often called ACIP, then makes recommendations for the use of that product. And then those recommendations are lifted or submitted to the CDC director for approval. Once that process is completed, then we have a product either authorized or approved that can be used. And here in North Carolina, we also have one additional step typically, which is the North Carolina Department of Health and Human Services then releases statewide standing orders, and that allows providers then to administer that product.
And well, I understand that the vaccines were initially all approved under the emergency use authorization. Have any of those vaccines now been approved fully by the relevant agencies?
Yes, we have seen the Pfizer vaccine be fully approved for 16 and up. And just recently, I believe it was at the end of January, the Moderna vaccine has been fully approved for 18 and up. The Pfizer vaccine remains under the emergency use authorization for other age groups.
And to date, have those vaccines proven safe and effective at preventing people from contracting COVID-19?
Yes, not only have they been proven safe and effective in helping reduce and prevent actual infection, but have gone on to be proven effective in, if you are infected and vaccinated, that they reduce your likelihood of severe illness, hospitalization, and death. And those who are vaccinated and do get infected tend to have a shorter duration as well. So continually, showing and demonstrating their effectiveness. And we saw that and continue to see that during the most recent Omicron surge, where yes, we saw folks who were vaccinated did get infected. That is, that wasn't a surprise. We all know that vaccines are not 100% effective. And so we did anticipate that we would see individuals who are vaccinated, get infected. But as we saw through the surges and even still through the Omicron surge that we just went through and are now starting to see the decline, that those overwhelmingly, those who are in the hospital to the tune of 70% of those who are hospitalized were the unvaccinated, with far less burden of hospitalization in those who were vaccinated, and even further less burden in those who were vaccinated plus a booster, single digit burden of hospitalization.
And maybe within there, you answer this question, but can a person who is vaccinated still contract COVID?
Yes, and so that's what we call the post-vaccination infections. It is possible, again, just to reiterate that no vaccine is 100% effective. The vaccines that we have are safe and very good and very effective, but they are not 100%. So, there's always going to be a small, a percentage of that group that is going to experience an infection. So again, that is not a surprise to public health professionals and anybody who's been working, with vaccines for a long period of time, that all vaccines have that because we don't have a vaccine for any of our preventable diseases that are 100%. And so, yes, someone who has been fully vaccinated may become infected. And again, as I said earlier, what we know is that if someone who is vaccinated does become infected, they are far less likely to have severe illness, hospitalization, and death. And so not only are the vaccines helping to prevent actual infection, but they are going further to help protect the most severe of outcomes. And typically those folks will also have a shorter duration.
So if a person who is vaccinated can still contract COVID, can they still transmit COVID?
So anyone who's infected with COVID-19 can transmit, but I want to just step back one and say that vaccines are safe and effective in preventing infection. And so if you never get infected, you can't transmit, right?
Sure.
And so that's part of what vaccines are doing for us, and that they prevent infection. And so, but yes, if someone is vaccinated and does end up being infected, they can transmit. Yes, because if you're infected, that can occur.
Is a vaccinated person less likely to contract COVID and therefore less likely to transmit COVID?
That's correct. So a person who is vaccinated has protection against infection. Again, it's not 100%. And that's why we see some of that post-vaccination infection. But yes, there is protection for someone who is vaccinated against actual infection. And as I said, if they were to become infected, then their likelihood of severe illness, hospitalization, and death is lower than those who are unvaccinated.
If a person contracts COVID, does that provide them with a level of immunity against future infection?
I think you're referring to what folks call natural immunity, so the infection-induced immunity.
Yes, ma'am.
And so natural immunity, as some folks call it, or infection-induced immunity, can provide some protection. But studies really do vary about how long and how much. Now, what's really interesting is that natural immunity, when compared to natural immunity plus then getting vaccinated after your infection, showed a reduction in reinfection. So that natural immunity just by itself actually showed 2 times more likely to become reinfected, whereas natural infection plus a vaccine actually reduced the risk. And it, again, just showing how effective vaccines can be in boosting even natural immunity.
And so is it fair to say that the level of immunity that you get if you're infected with COVID is maybe not as consistent as the immunity conferred by vaccination?
It's not determined. It's not well determined. And so what we know is some protection is conferred, but we are very unsure about how long and how protected. And just to note that natural immunity requires you to become infected. And there is risk with COVID-19 infection. At this point, in our nation, the last time I checked, we had over 4.4 million hospitalizations since the summer of 2020 until now. And so there is risk with being infected with COVID-19. And so not everyone will have mild symptoms or mild illness. Sometimes COVID-19 is quite serious, and it's not always easy to predict how your body will respond to COVID-19. So vaccine, again, as a public health tool, vaccine provides good level of protection without having to actually experience the illness.
So if a vaccinated person contracts COVID-19, is their risk of hospitalization or death higher, lower, or the same as an unvaccinated person that contracts COVID-19?
At this point, what we've seen through the pandemic is that vaccinated individuals have a lower risk of severe illness, hospitalization, and death.
And over the course of the pandemic, have you been tracking trends in infection rates and hospitalization?
For locally, correct, yes.
And have those rates of infection, hospitalization, and death been higher in unvaccinated persons than in vaccinated persons?
That's correct. There is good statewide data on that as well. As I mentioned earlier, the state Department of Health and Human Service respiratory report routinely shows the burden of hospitalizations and ICU utilization stratified by vaccination rate, and now even shows it by vaccination plus booster. And what we know is that overwhelmingly, like as I said, about 70% of all hospitalizations are in those who are unvaccinated versus a much smaller percentage in those who are vaccinated with the full series, and then single digits for those who are vaccinated with their full series and receive a booster. And still overwhelmingly throughout the course of all of the confirmed cases that we have, that overwhelmingly most of those were in the unvaccinated.
And would that trend in data remain the same even if we were to remove, say, the early portion of the pandemic when everybody was unvaccinated because no vaccine was available? This is a trend that has continued. Worse outcomes for unvaccinated people as compared to vaccinated people, even removing that data set?
That's correct. We still see that trend even with the most recent surge of Omicron.
Does the level of immunity conferred by vaccination wane over time?
Yes, studies have shown that over time, just like natural immunity, but that's true for both of them, that over time that immunity can wane. And that's precisely why you've seen public health, our leading public health entity as a nation, the CDC and others, providing guidance around the use of boosters to help bolster that immune response, particularly after a certain amount of time.
And is that true for other vaccines for dangerous diseases? Do they wane after some time?
Yes, that's true. That can also occur, and that's again, COVID-19 vaccine is at this point is sort of starting to look like a multi-dose. It has two doses for its primary series, and now recommendation of a booster. It's not uncommon for vaccines to have multiple doses. We have seen that. We do have a history in our vaccine schedule where other vaccines also require more than one dose.
And does the fact that a vaccine does not provide immunity forever after your first dose mean that it is not helpful as a measure for preventing disease?
I'm sorry, can you say that again for me?
That was poorly worded. Despite the fact that repeated doses are sometimes necessary, are vaccines still effective measures for preventing diseases?
Yes. As I said, it's not uncommon for a vaccine to require more than one dose, and that particularly with a novel virus where we have learned so much in 2 years and continue to learn, we are still finding out lots of information about COVID-19. So that is not uncommon for vaccines to need more than one dose to confer the best level of immunity.
So does the Buncombe County Health Department recommend that every eligible person be vaccinated against COVID-19?
We do. So Buncombe County Public Health does recommend that if you are eligible for your vaccine, to please consider getting your vaccine, that we do know that they are safe and effective, that they are helping to prevent infection. They are helping to prevent severe illness, hospitalizations, and death. That is very important. Yes, no vaccine is 100%. And so we will see individuals who are fully vaccinated get infected. But more than that, when that does happen, the vaccine is keeping folks from severe illness, hospitalization, and death. And that is really important. We've lost 530 of our neighbors in Buncombe County to COVID-related deaths. And that just is added to our state death toll and then exponential to our national death toll.
And so the Buncombe County Health Department recommends that every eligible person be vaccinated. Does the CDC also recommend that every eligible person be vaccinated against COVID-19?
Correct. Yes, that is their recommendation as well.
And we're talking about eligible people. Are there people who cannot be vaccinated?
That's true. And so the biggest group of those are less than 5-year-olds right now. So we have eligibility for all other groups, and except for our youngest in our population.
And is it fair to say that those persons who cannot be vaccinated present a higher risk of infection for a population than vaccinated persons?
Well, they pose
I'm going to object to that as a leading question. There's been a lot of leading questions, and I'd ask open-ended questions.
Mr. Maddox, can you rephrase the question?
Certainly. Do persons who are not vaccinated present a higher risk of infection than a vaccinated person?
On an individual level, an individual who is not vaccinated innately has a higher risk because they don't have protection from utilizing a vaccine. So they innately will have a higher risk individually.
And is that the case regardless of whether they're eligible to be vaccinated?
I'm sorry, restate that or say that again.
Certainly. If a person is not eligible to take a vaccine, they still present a risk to the public?
Well, individually, they have a higher risk of infection if exposed because they don't have protection, and thereby, if they don't have that protection to help prevent illness, they are at higher risk for contracting the illness. And then, of course, when someone is infected, they can transmit to other folks. And so, this is why it was very important throughout the pandemic that in addition to our vaccine, that we have layered approaches to help folks continue to mitigate and reduce their risk of not only exposure but risk of spread. So
that brings me to sort of the next question. Assuming adequate resources, is testing for the presence of a disease of COVID-19 a viable strategy for mitigating the risk inherent in unvaccinated persons?
So in general, yes, testing is a key tool for public health, and that that's both at sort of that individual and that community level that effective and quick identification of a confirmed positive is very important in helping to break the cycle of exposure and spread. And on an individual level, it's very important, and it's a very important public health tool so that we can quickly identify that individual and have them, one, isolate so that they're not continuing to spread, but also help with any now in this landscape, help connect to resources for treatment if they are at high risk for severe illness, and treatment may help with that. And so at an individual level, it's very important. At a community level, the testing that occurs is really important for us to understand transmission and burden of disease. And again, very, very important to the case investigation, contact tracing portions of what public health does in response, that if we can quickly identify individuals who are infected and positive, and obviously then infectious and can transmit, then we're also able to quickly identify those who might have been in contact with that individual and notify them of their exposure and hopefully break that cycle and break that spread.
What types of tests are available for COVID-19?
So typically there are two types of diagnostic tests typically that are used for public health purposes. One being the PCR, that typically is the gold standard. And then the viral antigen tests are also used for diagnostic.
And both of those involve the same collection method?
Roughly. Some of them may, and this is probably far too clinical, but some may require nasopharyngeal, which is a slightly different than just a nasal swab, different, going further up into the cavity. But essentially, they're either a nasal swab of some sort. There are other methods as well that have been developed that can use saliva as well.
But regardless of the samples are collected, then you apply either a PCR or an antigen, or what I think is commonly referred to as rapid testing kind of protocol to those samples.
That's right. So once a sample is collected, it is then tested, and it can be tested by either PCR or antigen. You're right that oftentimes people refer to the antigen test as the rapid test because typically it takes a shorter period of time, although there are rapid PCR tests available too, but the gold standard PCR takes a little bit longer than the 15 to 20 minutes that people are used to. But yes, those samples would be then processed using those methodologies, either PCR or antigen.
And are those tests accurate 100% of the time?
Well, just like vaccine, no testing methodology is 100%. And so, but both do show great specificity and fairly great sensitivity, particularly for the PCR, meaning that very few false negatives with the PCR. The sensitivity on the antigen is slightly less, but still quite good. And so both are used for diagnostic tools.
So given that, are they still an effective measure for detecting and therefore limiting the spread of COVID-19?
They are effective testing tools, and public health does use them as one tool in our response to help reduce the spread, because as I said earlier, the quicker that we can identify those who are infected, the more likely we are to break that infection chain.
So since the beginning of the pandemic, has the Buncombe County Health Department put out community updates on the number of cases and other information pertaining to the pandemic in our community?
Yes, and typically that's been almost weekly. Sometimes in times when we've had surges that have dissipated and the cases have waned. That cadence has changed slightly, but yes, we routinely put out what we call community briefings that detail what our local metrics are, any trends that we're seeing, and any recommendations that we have for the public or our local leaders.
And are those community updates available on a website, on the Buncombe County Health Department's website?
Yes, they are available on the website in a written form, and then when typically now we do those briefings as part of the Board of Commissioners briefing. And so those are also, I believe, streamed live from the Board of Commissioners or the Buncombe County Facebook live stream.
And at this point, I need to ask Madam Chairperson, Mr. Henning, I would like to show my witness a document and have her authenticate it before it's entered into evidence. And I'm curious as to what procedure you would like me to utilize to do that in this format.
Do we have the documents? Do the board members have it?
You should.
Which exhibit? I have things from the city that have exhibit A, B through exhibit K.
At this point, I would like to show her the document marked exhibit H.
Does everybody, board members, does everybody have it? It's several pages and it has an exhibit sticker that says H in the corner.
And Madam Chair, if the board would like, Mr. Henning Mr. Maddox can also share his screen, which would, or I can, which would display the document.
I have the copy here. Does anybody on the board not have exhibit H? Let me ask it that way. Would you all prefer for Mr. Henning to, after the document is authenticated, to share it on his screen? I'm sorry, Maddox. Too many Johns.
Yeah.
Well, I would like to share it with my witness, however.
Oh, certainly. That's fine. However you wish. I just wanted to make sure everybody had it and knew to which document you were preferring. So I'm not hearing anyone say they don't have it. So however you wish to proceed, Mr. Maddox.
Okay, if you will give me just one moment to work out technicalities here, I will bring the document up on my screen and then share it, and then I can ask Ms. Saunders if she recognizing it and so forth.
While Mr. Maddox is doing that, I got a note from a paralegal that the sound quality is apparently not good on the YouTube channel. And I just want to make sure everyone has muted. It looks like everyone has muted their screen except for, I don't know what this 855 number is. I don't know if that should be muted, if that would help. I don't know, maybe Ms. Barrett, do you know anything about that? Okay.
I don't, but I did just mute it.
Okay, great, thank you.
Okay, Ms. Saunders, can you see that document I just presented?
It's coming up now for me. Yes, I do see it.
Okay, and do you recognize this document?
Can you scroll down just a little bit?
I'm trying to. It's going to go slowly.
Yes, I see the headline, or at least the title. Yes, this appears to be the written summary that our communications department puts up after the community briefings.
And scrolling down, I'm going to go down here to the bottom, page 22. I'm going to try to. It's going to jump around on me. Looks like this includes community updates back to at least July 24th of 2021. Is that correct?
That is correct. Just to note that July 2021 would be before my time, but that Buncombe County has, I'm sorry, 2020. I apologize. I see 2021 now. That is correct. We have routinely put up summaries of the community briefings.
And does this appear to be a true and accurate copy of the information that's presented on Buncombe County's website for the community updates?
Yes.
Okay, at this time, I would move to introduce the city's Exhibit H, the Buncombe County Community Updates, into evidence.
Mr. Denton, do you have any objection?
No objection.
It will be admitted. Thank you.
Wonderful. Now let me try to get my screen back in order. Okay, so looking back there to page 22 of this document that I'm sharing here with you here, the headline in the summer or July 24th says COVID infection rates show clear and steady increase. Do you see that?
Yes.
And within these community updates, what was the trend in cases in the summer of 2021?
So in the summer of 2021, we were, not just we as Buncombe County, but we as a state and as a nation were being introduced to the Delta variant, which was a new variant of COVID-19 that did show increased transmissibility or contagiousness, more so than the original or alpha type of COVID-19. And at that time, we were beginning to see an increase in new cases being reported to public health.
And was that uptick more acute among unvaccinated persons than with vaccinated persons?
At the time, and as I mentioned earlier, like we, at that time, we were also seeing that most of our new cases were in those who were not fully vaccinated versus those who were vaccinated.
And did that rise continue into the fall?
Yes, we did see, just like others, that the Delta variant surge as I said, we're introduced to Delta in the summer. That surge continued throughout the fall and didn't dissipate completely before Omicron surge began, before we were introduced to a new variant of Omicron. And so we didn't fully see the Delta surge return back to pre-surge levels before we were starting to see burden of Omicron variant in our community.
Now, are you aware that the city of Asheville in August of 2021 put in place a policy with respect to vaccination or testing amongst employees?
I am aware.
And are you aware of the broad outlines of that policy?
The policy was shared with me prior to this hearing, and that I understand it to be a vaccine verification with a testing reflex, what I would call a testing reflex. So vaccine verification, and if not vaccinated or if no desire to disclose, then a requirement of testing weekly of employees.
And did you have any part in the decision to implement that policy? Did this, you say no?
No, I'm sorry. I wasn't sure if you were done asking. No.
No, I stepped on your response. I'm sorry. So you responded no to that. You only reviewed that policy in anticipation of this hearing. Is that correct?
It was shared with me upon notification of this hearing.
Okay. And in your opinion, is vaccination and testing an effective means of preventing the further spread of COVID-19, especially in a situation when the number of cases is rising?
Yes, vaccine, as I've mentioned earlier, vaccine is a priority public health measure for the prevention of infection, and then also severe illness and hospitalization. Again, testing is a key public health tool in quickly trying to identify cases so that we can limit the further spread, particularly as we talk about indoor spaces.
So I have no further questions at this time.
Thank you, Mr. Maddox. Mr. Denton, do you have questions of the witness?
I do. Can we take this document down so that I have a clean?
Yes, I apologize.
Please? Thank you.
One moment.
Thank you. Give me just a quick moment to organize my notes. Ms. Saunders, is it Ms. Saunders or Dr. Saunders? How should I address you?
Ms. Saunders.
Thank you, Ms. Saunders. Thank you for your testimony this morning. How are you?
I am well, thank you.
Thank you. We are here in this hearing to talk about a policy implemented by the city of Asheville. You're aware of that?
Correct, that's my understanding.
And we've heard Mr. Maddox say that the purpose of the policy is to prevent the spread of COVID-19. Is that your understanding of the purpose of the policy?
My understanding of vaccine verification and testing policies is that it is to limit the spread within a workplace.
Okay. So you gave a lot of testimony about your opinion that vaccines reduce deaths and hospitalizations, right?
Well, yes, not just opinion, but also, CDC and other information and data that demonstrates the effectiveness. Okay.
I didn't see you put any data in front of us, but I do understand that that is the CDC's position and that is your position, right? That vaccines reduce death and hospitalization.
Correct. Vaccines are an important public health tool in the reduction of infection and then severe illness, hospitalizations, and death.
Now, we don't see any of that language in the city's policy around this vaccine and testing policy. The only language that we see in this policy is that it is meant to prevent the spread of infection. So is it fair to say that we can kind of focus our discussion just on whether or not and how much vaccines prevent the spread of COVID? Is that fair?
I'm not sure.
You asked her about 4 different kinds of questions in there with a whole bunch of statements. Could you maybe rephrase that?
Yes, if you could just rephrase it, maybe break it down, Mr. Denton.
Yeah, Ms. Saunders, I'm going to ask you questions just about whether vaccines prevent the spread of COVID because the policy only mentions the the spread of COVID as a purpose of the policy. Is that fair that I ask you those kinds of questions, Ms. Saunders?
Yes, I understand. And also would say that vaccines are important for the prevention of infection. And if vaccines prevent the infection, then they also are preventing the other poor outcomes.
Now, you talked a little bit about your advice that every eligible person receive a COVID-19 vaccination. Is that right?
That's correct.
And the only people you said are not eligible are children under 5.
The largest group right now that is not eligible for vaccine would be our children under 5.
Who else should not get the vaccine?
Other groups and other people, other individuals may need to talk to their providers about getting the vaccine, particularly if they've had an allergic reaction to ingredients within the vaccine. So that those are other groups that may need to talk to their providers about vaccine.
Ms. Saunders, shouldn't everyone talk to their provider about whether or not to get the vaccine?
We do recommend that folks do talk to their medical providers or medical professionals that they trust to learn more about vaccine. We obviously have lots of vaccine information on our website and continually and periodically release that, but we do encourage folks to also talk to their providers or, as I said, medical professionals that they trust to learn more about vaccine as they consider getting vaccinated.
I want to ask you sort of a hypothetical here. I'm going to kind of give you a hypothetical person to try and dig a little deeper into this. Let's say that I have a paralegal that works for me, and we'll say her name is Rosa. So if Rosa, my employee, is considering whether or not to get a medical treatment, can you just give us an idea of what she should do to figure out whether she wants or needs that medical treatment?
And I suppose you mean just in a general sense.
Yes, very much.
That any individual who is considering treatment or a medical procedure or anything should seek out reliable and trustworthy information about that treatment and about that course. That could include looking at information that's available from trusted medical sites. It could also include reaching out to their own medical provider if they have a medical home. It could also be reaching out to trusted medical professionals that they have in their networks to receive that information.
So she should reach out to medical professionals and possibly her doctor, is that right?
That's one potential way to learn more about a treatment or a medical procedure.
Why should she reach out to her doctor? Why is that important?
Well, for any medical procedure or treatment, if an individual still has questions or still wants to learn more, that's one source of information about a medical procedure or treatment. And as I mentioned, there are others as well that folks may want to, employ as well, which could be reliable and trusted sources of information that are available from other organizations or entities.
Isn't Rosa's own doctor in the best position to give her advice on whether or not to get a medical treatment?
Potentially.
Objection.
I'm sorry.
Objection, asking, this hypothetical is getting really far away from anything having to do with this case.
I would sustain the objection.
Ms. Saunders, should Rosa listen to my medical advice?
Objection. What does Mr. Denton's medical advice have to do, hypothetical medical advice have to do with anything having to do with relevance to this case?
Can you rephrase the question, Mr. Denton?
Ms. Saunders, can a lawyer give medical advice to someone about whether or not to get a medical treatment?
Can a lawyer do that? Certainly, but that would probably, particularly for medical advice and advice around treatment and therapies, we would be recommending, disciplines that work in that space, whether it's their medical provider whether it's, a national, reliable and trustworthy entity that does that type of work and has that information.
Should my employees view me as a reliable source of medical information?
I'm sorry, can you restate that? It should,
Yeah.
your employees,
So if I have an employee named Rosa, she works for me, and I give her medical advice, I say, hey, you need to go get this medical treatment. Am I a reliable source? Like, should she listen to my medical advice?
Objection. Ms. Saunders has no idea what Mr. Denton's particular expertise is with regard to medical advice.
Sustained.
Ms. Saunders, can a non-doctor give medical advice about a specific medical treatment to an employee?
and by non-medical, you mean does not hold a MD?
Correct.
So there is lots of medical information or just health information that is provided by non-MD sources that are still reliable and trustworthy, and that may even come from a multidisciplinary type of organization. And so health information, as long, can be provided by other entities when someone is, thinking about medical treatments and medical therapies. The recommendation, not just mine, but just in general, would be to look at that information, and also if other questions and additional questions or concerns or needs are there, to reach out. If you do have a medical provider, to ask those questions, but also to reach out to other, as I said, it could be entities that work in that space too, that provide reliable and accurate information about those treatments or therapies.
And as an individual is reaching out and seeking more information, how do they ultimately make a decision on whether or not to get a medical treatment?
I believe that would be up to the individual, and I can't begin to sort of propose exactly everything an individual would think through.
That's fair. So it is up to the individual at the end of the day, is it not?
Up to the individual to
decide whether or not they want a medical treatment.
Ultimately, yes.
Is that true of COVID-19 vaccines?
That's correct. While they are recommended, it is up to the individual to decide whether or not they will.
The city of Asheville recently made a statement that the city recommends every city employee to get the COVID vaccine. Are you aware of this recommendation?
No.
What do you think of that recommendation?
That recommendation is in line with public health statements that folks who are eligible should consider. We recommend folks who are eligible to start their series or to make sure they get the dose that they're missing.
So the recommendation was not to consider the vaccine. The recommendation was to get the vaccine for every city employee. What do you think of that recommendation?
That's still in line with what the CDC and even our North Carolina Department of Health and Human Services and locally public health would be recommending eligible individuals to get their vaccine.
Are there any city employees? Is it possible there's a city employee who should not get the COVID vaccine?
Objection. She has no way of knowing about the health status of every single city employee.
I'm going to sustain on the relevance.
Madam Chair, first of all, my understanding is when attorneys make objections that they only state their objection without adding in additional information that could tip off a witness as to how to answer the question. So if I'd like to proceed that way, that's the way I'm used to, unless you want to do it differently.
And I'm used to stating the basis for my objections.
It is quite normal and common practice for attorneys to state the basis for their objection, or even for the trier of fact to ask what the basis is.
May I also argue the relevance of this question then?
Certainly.
So the city of Asheville's policy is based on, and we've heard in the opening statement and through Ms. Saunders, the policy is based on the idea that every employee should get the vaccine because it's safe and effective. And so I'm asking Ms. Saunders, if every single employee for the city of Asheville, without exception, should get the vaccine? That could be the most relevant question I asked today.
Well, I would say, I would still sustain the objection in that it's already been asked and answered, that there are people who, for various reasons, maybe cannot or should not, and they should do that in consultation with their care providers.
Okay, may I follow up then?
Sure.
Ms. Saunders, it sounds like your previous testimony was that not every single person should get the vaccine. There are some people that should not get it. Is that fair?
The vaccine, the COVID-19 vaccine is recommended for folks who are eligible. And there are special situations that require medical consultation. And so, clearly if you're less than 5 years old, you're not eligible. So we would not be recommending that. And then clearly there are, as I said, your own medical history that through medical consultation may or may not, you may or may not be able to then proceed with vaccine.
And one of those reasons, I think you mentioned earlier, would be that some people might be allergic to ingredients in the vaccine, right?
That's correct. That is part of the medical consultation.
Okay. So when the city of Asheville recommends all employees get this vaccine, shouldn't they also say to first check with a medical provider to make sure that you don't have an allergic reaction to something in the vaccine?
At this point, though, even the public health recommendation, when we're talking generally for the public, the recommendation is that eligible individuals get the vaccine. In an ideal state, you would have, lots of different pieces of information around, unless you are, allergic to, specific, these specific ingredients. But in general, the public health message from even the federal administration is typically that we recommend eligible individuals to get their vaccine.
So it sounds like your testimony is that the public health message does not take into account that there are some exceptions to who should get the vaccine.
In general, and that's just for communications, but that even during our briefings, we talk about, as folks are thinking about getting their vaccine and still considering the pros and cons, that they reach out for additional information, whether that's from, again, reliable sources, their own medical provider, or other medical professionals.
So that recommendation that people reach out for additional sources of information, if the city of Asheville is telling everyone to get a vaccine, they should also tell people, hey, reach out for more information to make sure that it's an appropriate medical treatment for you, right?
Objection. Is the basis for my objection?
Yes.
She's asking what the city of Asheville should do or should not do in a hypothetical scenario again, and that's not within the scope of Ms. Saunders' question on direct.
Mr. Dent, do you want to be heard?
Yeah, so I asked her, since the city is recommending all employees get vaccinated, which that's in their policy, and they've said that a couple times here in this hearing, then I'm simply asking her as a public health expert if that is an appropriate message, or if that message should include, hey, check with your doctor to make sure you're not allergic to something in the vaccine.
I will allow the witness to answer.
Can you restate the question, please?
Sure. The city of Asheville has stated that every employee should get the COVID-19 vaccine. You just testified that while that's true, people should reach out for additional resources before they make that final decision. So my question is, shouldn't the city of Asheville also tell people, in addition to everyone should get the vaccine, shouldn't they also say, but make sure, check with your doctor, check with other sources of information to make sure that you're not going to have a bad reaction to the vaccine, make sure you're eligible, make sure it's an appropriate treatment for you?
That information could be included.
Should it be?
From a public health perspective, we would include that yes, folks are recommended to get the vaccine, and that if they are, still in need of information, that they reach out. It could be included. Whether or not it should, that is a decision that the city of Asheville makes for their policies.
Well, as a public health expert testifying with an expertise in public health, I'd like your opinion on whether the city of Asheville should have done that in their messaging.
Objection, asked and answered.
She has not answered this question.
I'm going to sustain the objection.
Madam Chair, I asked her, should the city of Asheville include this message? And she said they could. It's not my decision whether they do or not. And so I asked, you're testifying as an expert in public health. I think we're entitled to your opinion on whether they should or should not include that messaging. I think that
she's answered that question a couple of times. The objection is sustained.
Okay, I'm sorry. Forgive me. I didn't hear whether she answered whether the city should or should not. I know she said they could. Can someone refresh my memory on how to answer that?
Madam Chair.
I'm sorry, Mr. Maddox, I didn't hear you.
I said he's continuing to ask the same question over and over. I think you just gave him an answer and sustained my objection on that point. So I feel like it's appropriate to move on from this question.
Yes, the objection is sustained. Ask your next question, please.
Ms. Saunders, as a public health expert, can the city of Asheville recommend all employees get other medical procedures other than the vaccine?
As an employer, I will just say, and I am not an expert in employee law, so I cannot.
Objection, that's outside the scope of this expert's expertise.
I would sustain that objection, but rephrase the question.
Sure. As a public health expert, is it appropriate for the city of Asheville to recommend all employees undergoing medical treatment?
Answer.
Again, as a public health professional, I'm not an expert in employee law and what an employer can and cannot require.
Is it ethical for an employer to require all employees to undergo a medical treatment in your
Objection. Ms. Saunders is not an expert in the field of medical ethics and has not purported to be so.
Sustained. Ask your next question, please.
Ms. Saunders, one of my clients, Mr. Aldridge, let's just say hypothetically that he wants to go ahead and get the vaccine, and he's going to go and find a clinic that's going to vaccinate him. You've administered many of these vaccines, is that right?
Buncombe County Public Health has administered several thousand, yes.
And do you yourself administer them or just your department?
I do not administer them. Our staff of skilled nurses do that administration.
And have you been present for some of those administration of vaccines?
I have.
Probably many of them, correct?
Yes, very many.
Okay, so if Mr. Aldridge chooses to get the vaccine, and again, this is hypothetical, when he presents to a nurse at the health department, does that nurse and Mr. Aldridge have a doctor-patient relationship of any kind?
Do you mean a historical one?
No, I mean in the moment of administering the vaccine, is a doctor-patient relationship created?
A patient-provider relationship is created. That is the intent of vaccination efforts or any public health effort where we'll be doing either testing or vaccination, that someone does present and they are met in a medical type environment.
So if Mr. Aldridge, he was a city firefighter. So if he says, hey, I'm here for my vaccine, let's do this procedure. What happens? What does the nurse say? What does he say? What's the procedure of getting the vaccine for a city firefighter?
Well, before even presenting to the nurse, an individual who presents for vaccine will register with our administration, our folks working the administration, where they will complete intake forms and consent forms one part of that is not just your, your personal information and the information that we need to sort of, to give you the vaccine, but that also includes a brief medical history, particularly with any, that is just brief medical history of any previous things that we need to know about, but also any, it does ask about allergic, if you ever had any allergic reactions, and if you've had a history of certain other illnesses. That then is collected and reviewed through what we would call medical consult. And so we have a provider at our vaccine clinics that will review that intake form just to be sure that there's not any information that they provided that would preclude them from moving forward with getting a vaccine. If there is something on there that signals that this needs further evaluation, the medical provider will then consult with the individual, and then based on what they find out, either the individual will move on or they won't. If the individual moves on, the nurse who is administering, or the pharmacist in some cases, who's administering the vaccine will look over the forms again as another check and make sure that there's nothing else that they see on there. They will verify that the medical consult has occurred. They will, then explain to the individual exactly what is going to happen, exactly what product they're getting. They will start to complete the vaccination card that we provide with the information on the vaccine. They will inform the individual of what arm they are going to place the vaccine, and then they will proceed to administer the vaccine. Afterwards, they will complete the vaccine card with the remaining information, including if it's their first dose, when they are expected to return for, or when they would be eligible for their second dose. And they present the card to the individual, and at that time, the individual is moved to an observation space because folks getting COVID-19 vaccine are observed for 15 minutes, just to be sure that there's no immediate reaction. That's overseen by an EMT, and after their 15 minutes, they are released at that time.
Have you ever seen a problem during those 15 minutes, like a reaction?
That's a great question. I don't recall any recent reactions to that. I don't recall any recent ones. In our early days of the vaccine clinic that was at AB Tech, we did have a few folks that, got flush or dizzy, those types of things. And our EMTs quickly assisted those individuals. And to my knowledge, there were no serious issues.
Anyone ever been taken to a hospital during those 15 minutes that you know of in Buncombe County Health Department?
Not that I'm aware of, and without, not that I'm aware of from my recollection.
Okay, let me back up. You said that you explained the product that this city firefighter, if he wants a vaccine, you said the nurse or the pharmacist would explain the product to him. What does that include?
The nurse will explain essentially like what vaccine they're getting and what type, and that has also changed over time, as now folks have come in sometimes with a preference, and so will tell us what they want, but they'll go on to, even with preference, they'll go on to talk about which vaccine they're getting, which dose they're getting, and what interval they'll need their next dose at. They will talk through, how they're going to administer it, that there might be pain at the injection site, and then ask if they have any other questions that they can answer before administering the vaccine.
Okay, is there anything else that you would tell Mr. Aldridge before he gets his vaccine?
I'm giving just the general overview, and that's generally how it happens.
So, You said you've been present for administration of many vaccines.
Correct.
So I'm trying to get a more specific overview since you've been there for many of these. I'm just trying to understand what Mr. Aldridge would be told before he gets his vaccine. Can you give us something more specific, or as much as you can remember?
Objection. Asked and answered. She's provided a pretty comprehensive overview of this entire process.
Sustained.
Ms. Saunders, what would a nurse or a pharmacist say to Mr. Aldridge if he asked whether or not the vaccine could cause cancer?
So if individuals have questions around side effects, our nurses and pharmacists, even our medical consult, can provide additional information about what they may experience as common side effects. They can provide them additional information based on the questions that they ask. And so depending on the question, our nurse, pharmacist, or our medical consult would provide the information as best we know it from our guidance.
Okay, and as a public health expert, what is the information as best you know it on a response to that question?
Specifically to cancer?
Yeah.
That as far as I'm aware, that the side effects that are common with vaccine are ones that are relatively common for all vaccine administration, which would be pain or soreness at the place of injection. Folks may feel fatigued or tired afterwards, and that's fairly common. To my knowledge, I'm not aware of a severe reaction of cancer.
Do you know if the vaccines were ever studied on whether or not they are carcinogenic?
I don't know the specifics of what the vaccines were studied on. I'm aware of the process that takes place at the FDA, the clinical trial, in general, the clinical trials that happen beforehand, and then the FDA process, and then the ACIP and CDC process. But I am not an immunologist or a vaccine researcher.
What if someone, what if a firefighter has heard something crazy on the internet, and he comes to get a vaccine, he says, hey, is this going to cause me to be infertile? Is this going to cause infertility? What's the response to that?
So with any individual that presents at the vaccine clinic, if they have questions regarding any part of the vaccine and possible side effects, we answer that as best we can with the knowledge that we have based on the information at the time. And we also, direct them to where they can find more information about potential side effects if they have, lingering questions about that.
What is the best information that you're aware of at this time on that issue of infertility?
Objection. I believe Ms. Saunders has not expressed that she has any particular expertise about infertility with relation to these vaccines.
I'm sorry, Mr. Maddox, you faded just a bit. Can you just repeat that again?
Yes, Ms. Saunders has expressed that she has no particular expertise with respect to infertility and vaccines.
Objection is sustained.
Madam Chair, that is not what Ms. Saunders expressed. She said that she's not a vaccine expert. She's not expressed whether or not she has any expertise on infertility. I asked her what the response to that would be, since she's aware of administering vaccines, and she said the response would be the best information that we have available. So I actually don't think I got a response to that. Madam Chair, if you could let me know if I've gotten a fair response to that or not.
And you can ask her that question, counsel.
So Ms. Saunders, again, if a firefighter has some crazy idea that the vaccine causes infertility and asks a pharmacist or a nurse or yourself who's present while they're being administered a vaccine, what kind of a response can that firefighter expect to get?
An individual can expect to get any response to their questions that, if they have concerns or, are expressing any concerns of things they're not sure about. They can expect to get information that has been provided and, provided and relevant and trustworthy from, particularly in our public health system, the CDC. And so we would be leaning on what information the CDC has regarding.
And what information is that? On infertility in particular, what information is that you'd be leaning on?
I'm sorry, I cannot answer that right now.
Okay. Would a pharmacist or a nurse who administers the vaccines be able to answer that?
Objection. She can't testify as to what somebody else might know.
Objection sustained.
She's an expert witness who is present at the time of administration of vaccines. I'm asking her what the response would be as an expert. She also is the employer of the people at the
And I stated the basis for my objection and it was sustained.
I would sustain the objection in that she was not present for every permeable question that could come from something somebody read on the internet. I think she gave a general answer in that any questions individuals have, they have the opportunity to consult with medical professional is there, and that issue can be addressed at that time.
Ms. Saunders, do you hand any paperwork to people as they get the vaccine?
Yes, we are required to give them the vaccine information sheet. That's a requirement that has information about the vaccine itself. Again, possible soreness and things like that, but that's a requirement to give the vaccine information sheet.
Okay, does the vaccine information sheet say anything about infertility?
I cannot speak to that. I do not have it in front of me.
Are you aware of the package insert that comes with the Pfizer vaccine?
I'm aware that a package insert does come in the box with the vaccine.
Have you ever read that insert?
No.
Okay. Are you aware that insert says there is no data on whether or not the vaccines cause infertility?
I have not read the package insert.
Are you aware that the package insert says there is no data on whether the vaccines are carcinogenic?
Objection.
Counsel asked the next question. She said she hadn't read it.
Ms. Saunders, is it necessary to give this firefighter informed consent before he undergoes a vaccine?
That is part of our process.
And part of the informed consent, it's a two-part. One is he has to be informed of all the risks and the benefits of the vaccine, right?
That's in general, like the informed consent does, cover the vaccine. Any informed consent would cover, the process and potential for the side effects pieces.
And the consent part is that he would have to, after learning the benefits and the risks, he then consents to the procedure, right?
Correct.
So in the process of informing a firefighter of the risks and benefits of the vaccine, are you able to tell someone what the risk is of COVID-19? If they don't get the vaccine, what is their risk from COVID?
I'm not sure I understand your question.
Yeah, what is, if there's a 40-year-old male firefighter looking to get the vaccine, what is his risk for dying of COVID?
Well, that is a very hard question to answer as COVID affects people very differently. And that individual risk is not one that I can begin to tell you. I can't tell you the individual risk that that a person has because it affects people very differently.
And it affects people differently based on their personal health situation, right?
It can affect people very differently based on their underlying medical conditions, yes, previous health history.
So it's very difficult to tell people what their risk is from COVID when they come to get a vaccine.
It's difficult to predict their individual risk of I believe you had asked if it was dying or I'm not sure, I can't remember, but it's difficult to predict that individual risk, not knowing, the complete, even with the complete medical history, COVID affects people very differently.
That's fair. So, and that's why the CDC gives estimates based on the entire population of what is called the infection mortality rate, right?
Yes, well, typically, when we have a situation like COVID, that we have lots of information based on population, and we can create public or epidemiological or surveillance types of tools that help us understand relative risk and case rate data, those types of things.
And do you know what the CDC estimates the infection mortality rate is for a 40-year-old man?
I do not have that in front of me now.
Okay, so last March, the CDC gave a best estimate for infection mortality rate for 18 to 49-year-olds is 500 per 1 million people. Does that sound accurate?
I can't say without looking at the document myself.
Isn't that an important number to know when you give someone, make sure you get informed consent from someone before they get the vaccine?
I think it's important for individuals to understand the risks and benefits and that the risks do remain, that those who are unvaccinated are going to be higher at risk for infection, potentially then, higher at risk for severe illness, as vaccines have demonstrated that they can be effective and are effective against severe illness, hospitalizations, and deaths. In the absence of giving exact numbers of their relative risk, it's important for folks to know that the risks of COVID-19 are quite serious, and that we have tools that can help protect them. And then we recommend that they do so.
Are you aware that 500 per 1 million people is 0.05%?
That sounds about right as far as doing math in my head very quickly.
So if my firefighter goes to get the vaccine that the city of Asheville recommends and requires to either get the vaccine or be tested every week, if he goes and says, I'm a 40-year-old man, what's my risk for COVID, of dying of COVID? The CDC's number is 0.05%.
Objection. He's asking her to testify about data that's not in front of her, to attest to a hypothetical person walking in a door.
Objection sustained.
Ms. Saunders, are the people who administer the vaccines to City of Asheville employees, are they telling City of Asheville employees what the risk is of dying from COVID?
I can't fully answer that. We are not the only providers. There are several providers in our community that provide vaccine, and I can't begin to speak for all of those providers and what they are including in their education.
What does your provider tell people? Do they tell them what their infection mortality rate is for their age group?
I would say that there is no specific percentage as you're stating it. We do, counsel and inform people and educate folks about the risks of COVID-19 when asked about the risks of COVID-19 in more of a general sense. And we also provide, information about COVID vaccine to individuals who present.
How can you obtain informed consent from someone if you're not able to articulate the risk of not getting that treatment?
The consent forms and the informed consent are really in place to let folks know what to expect with the COVID vaccine, why the COVID vaccine may be important, the risk of that COVID vaccine, and other pieces.
Do you inform people getting a vaccine of the risks of blood clots or myocarditis or Guillain-Barré syndrome?
I can speak that several of those are on the intake form to be assessed. But again, I do not have the intake form in front of me to fully
So I'm not asking if they're
We're gonna take a 10-minute break right here. If everyone can just take a stretch break, be 10 minutes, we'll come back at 11:30.
Thank you.
Hey, is everybody back and ready to resume? Looks like it. Thank you, everybody. And before we resume, is everyone okay with a 12:30 to 1:45 lunch break? Am I getting thumbs up from everyone? Okay. All right. Ms. Sanders, you're still under oath. Mr. Denton, the witness is still with you.
Thank you, and thank you for your time, Ms. Saunders. I'm trying not to take up too much of your time, and I appreciate your testimony. I'll try to move through quickly so that you don't have to be taken away from your duties for too long. Has Buncombe County Health Services recommended this kind of an employer vaccine or test policy to anyone in the county?
In the summer of 2021, as part of the community briefing, and I can't remember the exact community briefing, but in the summer of 2021, there was a general recommendation for Buncombe County leadership to explore and implement a vaccine policy, which did not necessarily state what type of vaccine policy, but that recommendation was put forth to the leadership of Buncombe County to explore based on North Carolina Department of Health and Human Services and CDC recommendations that were and still are encouraging, had guidance around encouraging vaccine verification and testing in workplaces. That interim guidance for Department of Health and Human Services is still in effect, as is, I believe, the recommendations for the CDC from the CDC.
So, does the CDC recommend employers implement these kinds of policies?
In the CDC guidance, it states that particularly testing of unvaccinated workforce when asymptomatic or not exposed could be an effective way to limit infection and limit the spread of infection. And the North Carolina Department of Health and Human Services, in their interim guidance for businesses, and I believe the interim guidance for businesses that are public facing, has both those strongly encourage workplaces to require vaccination status and testing of unvaccinated or those who do not disclose their vaccine status, weekly testing as part of their guidance in the workplace document.
So, but you did not give any guidance to the city of Asheville on this particular policy?
No, my role is not to provide employer policy. As I stated, my recommendation at the time of the Board of Commissioners briefing, the recommendation was for Buncombe County leadership to explore and implement a vaccine policy, but it is not my duty to implement the policy or dictate.
From a public health perspective, could a policy like this have any negative consequences amongst employees?
I'm not sure I know what you mean. Is there something more specific?
Sure. People don't like being told what to do in general. And so is a policy like this possibly going to anger employees who feel like they're being told what to do?
Objection.
Sustained.
I'm confused. What's the grounds for the objection?
You're asking her to testify about what somebody else might possibly do? How they might possibly react to something?
So I'm not sure which rule of evidence is being objected to.
I don't think she would have the knowledge to know what some random employee might or might not like. And she said that she doesn't know employer law or make those recommendations.
Okay, I'll follow up. Ms. Saunders, as a expert in public health in Buncombe County, is it important for you to prevent the spread of COVID-19?
Yes, it's, as I mentioned earlier on, it's one of the duties of a health director is to investigate and mitigate communicable disease, and COVID-19 is one of those.
And one of those duties would also then be to investigate policies that attempt to prevent the spread of COVID-19. Is that right?
I'm not sure I know what you mean in the sense of policies. Do you mean public health measures?
Sure, like the city policy of vaccinating and testing, you could call a public health measure. So is it part of your role to look at the efficacy of those kinds of public health measures?
Objection, she already cited that she does not review individual policies from different employers.
Sustained.
So Ms. Saunders, you don't investigate these kinds of public health measures implemented by employers. Is that your testimony?
Employer policy is not my duty to investigate nor review. That I don't review employer policy in general for any workplace around this. My duties are around investigation and surveillance and mitigation of communicable disease.
So you have no opinion on the city's policy that they've implemented here?
To my knowledge, it's an employee policy.
Okay, so you don't have any opinion as to whether it prevents the spread of COVID-19?
The employer policy itself, I don't review employer policies on that. As I stated earlier, in general, public health measures have included vaccination. It is our top public health priority and measure to help reduce the spread, and then also, if infected, to reduce severe illness, hospitalizations, and death. Earlier also mentioned that testing remains, has always been through our pandemic response, also a key public health tool to helping identify cases very quickly and reduce the spread of disease. In addition to that, we've used other public health measures that I mentioned earlier as well, that include the social distancing, face coverings, and hand washing. Those are all public health measures.
Is there any data that you're aware of that vaccine or test mandates actually reduce the spread of COVID-19?
In reference to, I'm sorry, can you restate that?
Sure, we've been talking about this policy quite a bit, and we understand the policy is that you either vaccinate or you get tested every week. So is there any data that that kind of a policy or that kind of public health measure actually effectively reduces the spread of COVID-19?
I haven't seen any published data around that, but as I mentioned, public health practice includes vaccination as a key tool in the mitigation of not just COVID-19, but other vaccine preventable diseases. And again, testing is another valuable public health tool in addition to those layered approaches that we did use early on and continue to use around social distancing and face coverings and hand washing.
Are public health practices based on data?
Yes, typically the public health practice or public health measures are based on what we know will help limit the spread. As I mentioned, our control measures early on when we did not have vaccine really relied on those tried and true public health measures that have been around for decades, well before vaccine, to help limit the spread as we, encouraged and recommended folks think about their interactions, think about their time they're spending indoors, and for, how close they are indoors to other people. And all of that is based on, what we know helps limit the spread. And then I can't begin to sort of talk about the multitudes of data out there around the effectiveness of vaccine. As I mentioned earlier in the hearing, that vaccines for several decades now have been, helping us decline morbidity and mortality of several diseases.
So Ms. Saunders, and again, I'm trying to be a little more specific, so I'm not talking about past vaccines, and I'm actually not even talking about morbidity. I'm talking about the spread of COVID, and I'm wondering if you have any data, have you brought any data, or can you reference any data that says public health measures which require vaccines or testing actually reduce the spread of COVID-19?
I don't have any of that published data. I don't have any of that data with me today.
Okay, are you aware that that's probably the most important point of this hearing, is whether or not this policy reduces the spread of COVID-19?
Objection. How is she to have any knowledge of what is the most important point in this hearing?
She testified that she reviewed the policy before the hearing.
You testified she reviewed the policy, that she is not supposed to weigh in on the individual importance of various things at stake in this hearing.
Objection is sustained.
Ms. Saunders, you said earlier that the vaccines are safe and effective, right?
Correct.
Are they safe for everyone?
In general, the vaccines are safe and effective. Of course, there are always individuals who, as we mentioned earlier, it may not be recommended that they receive a vaccine based on their own medical history or their history of allergic reaction. And so in general, the vaccines are safe and effective for most individuals.
But not all?
No, not all. No treatment, whether it's a vaccine or other medical treatment, is 100% safe for all folks.
Earlier, you testified that your job is to investigate COVID-19. So in your investigation of COVID-19, have you learned of any adverse reactions to the COVID-19 vaccinations that your department recommends?
So it's not my, my duty is to investigate local outbreaks and cases. When it comes to investigation of the severe outcomes, that's not necessarily the duties of a local health director, though, we are informed by what the CDC and FDA do find through their safety monitoring.
What have they found?
And so in particular, there are several different safety mechanisms, one of them being the VAERS database that does allow for not just health providers, but anyone can submit a report and can, submit them multiple times. And so those reports are helpful. Just word of caution that VAERS, while it can serve as an early signal for adverse reactions, anyone can report, and many of the reports within the VAERS can be inconsistent, they can be incomplete, and need verification. And so VAERS is one of those databases that, as I said, works as an early signal that vaccine safety experts will analyze that data, look for patterns, look for high numbers of things, and then go on to study that occurrence more intently to verify if there really is a link to vaccine with that. And though I won't be able to, tell you an exhaustive sort of list, but the VAERS data and then subsequent verification, the CDC and the FDA have informed not just health providers, but the public of rare, but events that have occurred as a result or are related to vaccine. And, there are a few of those that, obviously anaphylaxis is one of them that can be true for any vaccine. I believe myocarditis is one of them that is rare, but that also was an early signal from VAERS. That was many VAERS reports, and CDC and FDA did verify, I believe, a few thousand of those in the 500 and some million doses that were provided. And so now we do have, information about that to provide to folks. I do believe that is also included on not only the vaccine information sheets, but for the consent forms as well.
When you're talking about VAERS, are you talking about the vaccine adverse reaction system that records adverse reactions to vaccines?
Yes, apologies for using an acronym.
But you said that, I mean, are you saying it's unreliable?
I'm saying that that database is set up for not just health providers, but anyone to submit a report. That data needs to be used with caution until it's verified, because much of it is around just that it could be incomplete, it could be coincidental, because really what VAERS is designed to do is any type of reaction that happened around the time of your vaccine, folks are encouraged to submit. It then is the subsequent pieces, from my understanding, is that that then the CDC or FDA work with other groups when they see these signals. So if there's a pattern, if there's a high frequency of a certain event being submitted to VAERS, then they work to verify whether that event is related. And then based on that, continued safety and monitoring will release, if necessary, will release information around that adverse event.
Doesn't the CDC verify the VAERS data before they publish it?
The VAERS data, I think you mean, I'm sorry, can you clarify what you mean by that?
Yeah, isn't the VAERS data verified before it gets published?
The VAERS database, to my knowledge, is available for the public to see, and the data that is in there, the submissions that are in there are preliminary to my understanding, and like I said, is used as an early signal. So if there were a pattern or a high frequency, it's those adverse reactions that that have a signal like a high frequency or a pattern that would then get further investigation and then are verified.
So it's fair to say that some people have had serious adverse reactions to COVID-19 vaccines, right?
Objection, she just stated that there's a database, that the CDC maintains this database, that she said more about this database than I think many of us ever care to know. And she's also said that she's not an expert on the adverse events that can occur with COVID. We've had so many, or with those vaccines, I'm sorry, we've had so much testimony around this.
Objection is sustained.
Ms. Saunders, is it true that you are not an expert on the adverse events that people can have from COVID-19 vaccines?
I am a local health director. My expertise is local public health practice. Things, the monitoring and safety of vaccine is not, that is not held at a local level, while informed.
But you're recommending everyone get the vaccine and you're not looking into the adverse events from the vaccine? Is that true?
Objection.
Sustained. It's argumentative.
And
Madam Chair,
Madam Chairperson, I understand.
Argumentative is the purpose of cross-examination.
Madam Chairperson, I understand that I tendered this witness and asked her questions about measures to control the spread of COVID-19 and to show what the city might have in its head when it decides to impose such a policy. However, Mr. Denton is spending an inordinate amount of time asking different considerations a person might take before getting a vaccine and different things about adverse effects from vaccines, which is necessarily irrelevant with respect to a policy that does not require someone to get a vaccine.
Mr. Denton, you wish to be heard?
Yeah, I'd like to know what the basis of this objection is. I'm confused.
Relevance.
What rule of evidence we're
Relevance 403.
For all of my questions?
This entire line, we're getting pretty far afield.
So, Madam Chair, yeah, I'd like to be heard.
Sure.
This policy, first of all, recommends, you have a city recommending a medical treatment of all their employees, but it also requires to either vaccinate or test. And so I'm asking the city's witness whether the vaccine is safe and effective that she testified to on direct examination, and I'm getting into how safe it is for City of Asheville employees to get the vaccine. If a city employee does not get the vaccine, they have to pay for their own weekly testing. So there's a burden either way. And so I'm certainly entitled to explore the city's expert witness's opinion of why they're recommending this vaccine to every single city employee.
Everybody just be on standby for just a moment. I'm gonna consult with Mr. Henning. Thank you, everyone, for your patience. Mr. Denton, the ruling would be that it's not a relevant question. This witness has been given a lot of latitude to explore what her knowledge is about vaccine efficacy and any possible side effects, but she has not been offered to discuss issues about the policy itself.
That's fair. I'm not sure about the policy. That's fair.
So you may ask your next question.
Sure. Ms. Saunders, is it your testimony that the vaccine is safe and effective, but also that you have not explored the adverse effects of the vaccine?
The vaccine is safe and effective based on that it's demonstrated. So, and it is not my duty to collect those VAERS submissions nor track them. I am, we do receive information, all local health departments do, from North Carolina Department of Health and Human Services and the CDC regarding anything that they may find that health officials, including medical providers, but also public health officials or the community need to know.
Madam Chair, I'd like to share a document with the witness, and it is an exhibit that I presented. It's called CDC Omicron Spread, and I'll mark it as my exhibit D.
I'm going to object to introducing evidence on cross that was not introduced on direct.
Madam Chair, it's cross-examination. I'm entitled to question the witness on what she said. She testified about the transmissibility of Omicron, and I'd like to see what the CDC says about the transmissibility of Omicron. So it's just more helpful for us to look at the exhibit.
My question, I'm sorry, I was muted and didn't realize it. My question was, does the board have the document to which you're referring?
Yeah, it's titled CDC Omicron Spread. I sent it to Ms. Barrett a couple weeks ago.
Okay, hold on 1 second.
Sure.
Mr. Denton, you have provided the document. You may make reference to it, but you cannot introduce it into evidence.
Okay, that's fair. We'll talk about it. Ms. Saunders, you testified earlier that vaccinated people can spread COVID, right?
Correct, if they are infected.
And is that true of the Delta variant?
That's true of, any version of the virus. If someone's infected, they can spread the disease, spread the virus.
And that's true of the Omicron variant, correct?
That would be correct.
And are you aware that the CDC has a page on its website where it says the CDC expects that anyone with Omicron infection can spread the virus to others, even if they are vaccinated or don't have symptoms?
I'm not without seeing it, I can't speak to the exact source, but that, as I previously stated, if someone is infected, regardless of their vaccine status, if someone is infected, they have the potential for spread.
Okay, so vaccinated people can spread COVID. You said earlier that they're less likely to get infected.
Well, that's the nature of vaccine in general, right? That vaccines in general are meant to prevent infection. And then there are typically added benefits to that protection should a vaccinated person become infected. And so, as I stated earlier, breakthrough cases, as folks call them, or post-vaccination cases, do occur. And when they occur, what is found is that typically there's a reduced risk for severe illness and also of hospitalization and death for those who are vaccinated but do get infected.
Is it your testimony that one of the purposes of these COVID-19 vaccines was to prevent infection?
That's correct. That's the purpose of any vaccine when it's developed, is to potentially prevent infection. Yes.
You said earlier that vaccinated people are less likely to get infected. What data are you referring to?
I don't have the sources right in front of me, but that's that's the data that is provided through what the CDC recommendations are for the use of vaccine. That's the data that's.
What data does the CDC provide in support of that recommendation?
Again, I don't have the exact sources in front of me to cite that, but in general, the purpose of the vaccine is, one, to help prevent infection, which it does. And
how much does it reduce the likelihood someone gets infected by?
I'm sorry, I don't have that in front of me. I'm sorry. I can, I'm sorry, go ahead.
So for the purposes of this hearing, we're supposed to take your word for it that the vaccine reduces the likelihood someone can get infected with COVID.
Objection.
Sustained.
Are you aware that Dr. Anthony Fauci recently said that, quote, "I think in many respects, Omicron, with its extraordinarily unprecedented degree of efficiency of transmissibility, will ultimately find just about everybody."
I'm sorry, did I hear an objection, Mr. Matt?
Yes.
What was the basis?
I object to him reading off a statement that just for the purpose of saying, are you aware of it?
I would sustain that objection.
Madam Chair, that question's been asked 36 times. That's how you cross-examine a witness.
If it's been asked 36 times, it's been answered, so there's no need to ask it again. You can ask your next question.
I'm sorry, Madam Chair, the format of the question has asked been 36 times because that is the format of cross-examination. He just told me I could ask the witness about my CDC study. And I said, are you aware the CDC says, and then I quoted it, and she responded. And now I'm saying, are you aware of something Dr. Anthony Fauci said? And I was gonna ask her opinion if she agrees with that statement. This is cross-examination, this is how it works.
Counsel, just so you know, I've been a practicing trial lawyer for 32 years. I know the nature of cross-examination quite well. Thank you. Do you have any other questions? Objection sustained.
Ms. Saunders, will everybody eventually get the Omicron variant, in your opinion?
That's a very hard question to answer, given that there is no crystal ball to understand what variant we may encounter, if any, in the future. So it's very hard to answer that question. But vaccines are safe and effective in helping us prevent further infection, and when infected, helping us reduce that severe illness. But as far as looking into a crystal ball and forecasting the future, that I cannot answer that fully.
You said earlier that the vaccine's effectiveness to prevent infection decreases over time. Is that true?
That's true. Studies have shown that over time the immunity wanes for vaccination. Again, that is in part.
How long does it take to wane? What's the timeline on that?
Well, after your initial series, which is your two full doses, the recommendation is to get a booster at this point, 5 months. Initially it was 6. And so the data suggests that we start to see waning, around that 6-month mark.
Okay. And how much does it wane? Does it go down to 80%, 50%, 10%?
Studies vary on that. Initially, when the vaccines were authorized, we did see efficacy high in the very high 90% percentiles. Over time, with immunity, the immunity waning, and as studies have suggested, with new variants that also are slightly different than the strain that was our original strain, that we can see that drop, 10 to 20% percentage points. So that still puts us, the last studies I saw around it, or the last information I saw around it, puts us, anywhere around 70 to 80% on average, which is still quite good for a vaccine efficacy in real life.
The CDC cites a study that it reduces to 80% after 2 months, and it reduces to 0 after 6 months, which is why they recommend the booster shot. Have you heard of that data?
Without seeing it, I'm not familiar with that study.
Okay, so if a city employee gets vaccinated, their vaccine is going to wane over time. Is that accurate?
In general, that's what the studies have shown, is that we do have some vaccine waning over time, but with a booster, that immune response rebounds.
Okay, so you would recommend, if you want to make sure you are actually preventing infection, then someone has to get a booster shot. Is that right?
That's the recommendation at this time for those who have completed their full series and are eligible for a booster. They should do so.
And what if the booster shot wanes over time? What does someone do then to keep up that prevention of infection?
As I mentioned earlier in the hearing, it's not uncommon that vaccines may need additional doses over time. This is an evolving situation. Just as a reminder to everyone that this is a novel virus. We are still learning about it, and that also means that that knowledge is evolving over time, and that vaccines in the past have needed additional doses. It may mean that this particular in this particular response we may see additional need for a booster or some type of periodic.
So if you really want to vaccinate a person to not spread COVID, then they're going to need a booster shot every 6 months, right?
I can't say that. I don't know that that is true.
Okay. Have any other vaccines required 3 doses within 12 months that you're aware of?
Objection, relevance.
This is her
Okay.
testimony. She testified that other vaccines operate the same as the COVID vaccine, and so I'm exploring her own testimony.
The relevance is sustained for lack of relevance.
So, Ms. Saunders, I'm just trying to get my finger on how to prevent the spread of COVID with vaccines, because that's sort of why we're here. So if someone gets the first dose, the second dose, and a booster shot, it sounds like the effectiveness of all 3 of those could wane over time, right?
What we've seen in the as I've suggested is that we have seen waning after the initial series, and that a booster was necessary. As far as needing additional boosters, again, my duty as a local health director is not to supply that recommendation. That is a place where those recommendations will come through the study and the continued monitoring that the FDA and the CDC do to monitor that, and may recommend later on. You may or may not recommend later on the need for additional doses.
Let's talk briefly about natural immunity. You testified earlier that natural immunity, so people who have recovered from COVID, do not have as good immunity as they would if they got the vaccine?
No, earlier I suggested that with natural immunity, it does provide some protection, but studies do vary about how long that protection is. There are also studies that show that, I believe I referenced a study where natural immunity, when compared with natural immunity and then after infection getting a vaccine, it showed a reduction in reinfection, and that in that study, the natural immunity alone showed a higher risk. And if I remember correctly, it was at least two times more likely of a reinfection when compared to natural immunity, like a natural infection, and then getting the vaccine afterwards, and that essentially the vaccine is working and demonstrating its effectiveness there as well, and boosting even the natural immunity.
So there's a November CDC study on natural immunity that says natural immunity is at least as good as vaccine immunity. Are you aware of that study?
Without seeing it, I can't speak to that.
So naturally immune people have less, they have some, but they have less protection from getting infected with COVID, right?
I didn't say that. Again, studies vary about the duration of that immunity and the strength of that immunity.
Okay, kind of like the vaccines, where there's some kind of different studies on how quickly they wane or how quickly you lose protection from them, right?
That would, yes, it's similar in that respect with immunity, whether it's vaccine or infection induced. The difference, however, as I mentioned earlier, natural immunity does require someone to become infected, which does carry risk.
What risk is that?
Well, the risk of COVID-19 infection can vary from individual to individual, and not everyone has mild illness.
How many people die from the infection of COVID-19?
I'm sorry?
What percentage of people die from the infection from COVID-19? Since you're talking about the risk of COVID-19.
In Buncombe County, we've had 530 individuals that have had COVID-related deaths.
I know, and I was asking about the percentage, like the general percentage in the country or in North Carolina, what's the percentage that someone will die from COVID if they get COVID?
I'm sorry, I don't have a percentage available. I have, the burden of disease and death that, because I track that daily and can tell you that for Buncombe County, it's been 530 COVID-related deaths. I believe for North Carolina, the last I checked, it was over 22,000 deaths. And I believe for the U.S., for our nation, it's over now 930,000 COVID-related deaths.
But you don't have that in a percentage?
No, I'm sorry, I don't.
Okay. How many vaccinated people in Buncombe County have contracted COVID-19?
So the post-vaccination infections, at the last I checked, which was just a couple weeks ago, were roughly around 10,000 post-vaccination infections. That and currently, we have about 50,000 confirmed cases of COVID since pandemic start.
Okay, so do you have an idea of what percentage of vaccinated people end up getting COVID?
So based on our data, or at least that preliminary data, like that data that I just provided, that's roughly 1 in 5. So that would be about 20% of a post-vaccination rate, if I'm doing the math correctly in my head. 20%
of the COVID infections you're seeing are in vaccinated people in Buncombe County?
Overall, it looks to be about 20% are post-vaccination infections, which means that, about 80% of those are unvaccinated or not fully vaccinated individuals.
What does not fully vaccinated mean?
That would mean that they have not completed their full series.
What's a full series?
Depends on which vaccine that you receive. And so for Pfizer and Moderna products, that would be both doses. And then for the Johnson & Johnson, sometimes called Janssen, that would be the 1 dose.
So let's say a city firefighter and goes and gets a dose of Moderna, and then a week and a half later gets COVID, that's considered an unvaccinated infection. Is that right?
That's correct, because they are not fully vaccinated.
Okay. And the same would be true if they got 2 doses, but only waited a week after their 2nd dose, they would still be considered unvaccinated, right?
The definition for fully vaccinated is the full series and then 2 weeks after. That now sort of evolved over time to up to date to also include the need for boosters.
One of the elements of this policy is the PCR and antigen test. Are those approved by the FDA?
Well, what do you mean? PCR as a methodology?
Yeah, is it approved for testing people for COVID by the FDA?
So PCR as a methodology, that's not specific to any one test. That's a methodology. That's a specific type of testing methodology that's used in different to diagnose different diseases. We do have available PCR and antigen testing for COVID-19, but just PCR in general.
The tests that you have available, have those been approved by the FDA?
Some of the testing available has EUA. Yes.
Are there any PCR antigen tests you have available for COVID-19 that are FDA approved, fully FDA approved?
I can't answer that right now. I'm sorry.
You said you reviewed this policy before coming to this hearing. Do you know what kind of test this policy requires people to get if they don't get vaccinated?
I recall that it from my recollection, and I don't have it pulled up, that PCR or antigen is allowable.
Okay, and you're not able to testify whether either of those are fully FDA approved?
I'm sorry, I know that they have, many of those tests have received the emergency use authorization, but I apologize, I do not have current approval knowledge.
Okay. Give me just a moment. I think I'm done, Ms. Saunders. Give me just 1 minute if you all, just to check my notes, okay? Hold on. Ms. Saunders, last question. So I think you testified, you're not aware that FAERS is reporting over 20,000 deaths as a result of the vaccine and over 100,000, or I'm sorry, over 1 million injuries from the vaccines?
I don't know the exact number. Again,
Objection, asked and answered. I was on mute, I apologize.
Sustained.
Okay, I have no further questions. Ms. Saunders, thank you for your time.
Thank you, counsel. Mr. Maddox, I'm sure you probably have some redirect, is that correct?
Actually, no, I think I've taken up enough of Ms. Saunders. Mr. Denton, have taken up enough of Ms. Saunders' time, and I think we're content to rest on the information she already provided.
Well, the board does have the right to ask questions. I do have a few, I'm sure other board members may. So since we're sort of at a natural breaking point, why don't we break now for lunch? I have 12:20 and we can come back at 1:30. Does that sound good to everyone? Okay, see you then.
Hello?
Good afternoon, everyone. I have 1:29, so we've got just a minute to go. And then when we're told that we are going live, then we can get started.
You guys are live.
Thank you, ma'am. Good afternoon, everyone. I hope everyone had a good lunch break. Even though we can all see we're here, we'll just do a roll call of the members just for the record. Mr. Escovitz, and you're muted, but
Present.
Better muted than hot mics, I always say. Mr. Hunt.
Here.
Mr. Devereaux.
I'm here.
Mr. Webb.
I'm here.
And I'm chair and I am present. I think when we finished, or when we broke for lunch, Mr. Denton had finished his cross. Mr. Maddox did not have any redirects, so we are now at board questions, if there are any. And thank you, there's my witness. Ms. Sanders, thank you for coming back after lunch. So, Mr. Escovitz, do you have any questions?
Yes, I did. Can everybody hear me? Okay. Can I call you Stacy, by the way?
Yes, you may.
Okay. My background is in pharmacy, by the way. I spent 30 years as a professor of pharmacy at Ohio State University. And so I hope you don't mind the line of questions I'm going to ask you. I'm just going to ask, like the influenza that we see every year, it requires an annual vaccination. And in many cases, it's the requirement for employment to be vaccinated in the private sector. Do you see this happening with COVID-19 in the future?
So thanks for the question.
Annual vaccination, in other words, because of variants, perhaps.
As I mentioned earlier, it's a bit hard to predict the future right now, particularly around what requirements we will have ongoing for COVID vaccine. To your point, it's not uncommon for us to have vaccines, much like the flu, that do require a yearly dose to maintain immunity. But it's too soon to determine, and I have not seen at this time where there's any definitive answer to that we would go to every 12 months or some other interval at this time.
And probably most people are aware that influenza or flu, like colds, is another example of a coronavirus like COVID-19. So it's we've had that in our among our communities across the country for a number of years. I'll ask another question a little later, but I'll let the other members of the board continue on.
Thank you, Mr. Escovitz. Mr. Hahn, do you have any questions?
No, at this time I'm good.
Thank you. Mr. Devereaux, do you have any questions?
Yes, I have a couple questions for Ms. Saunders. First off, Mr. Denton asked you some questions about kind of related to the risk for an individual of getting the COVID. And one line of questioning had to do with the risk that a 40-year-old male might have. And I think he quoted some CDC mortality rates, something of the range of 500 deaths per 1 million men, in that mortality rate. which was, I think he quoted as doing the math, a 0.05% risk of death. Well, when I continue that math, I see that's 500 in a million is 1 in 2,000. 1 in 2,000. I think as I follow the statistics, 1 in 355 Americans have not at risk of dying of COVID, but have already died of COVID. 1 out of 355 man, woman, and child has died of COVID in our country. I'm just asking your professional judgment as a public health professional, is a 1 in 2,000 death rate something that you would consider a serious public health risk? Never mind that every individual is different, but is 1 in 2,000 something that public health professionals pay attention to?
Death rates are absolutely one of the indicators that public health officials at all levels do pay attention to. And just to sort of reiterate that's equating to right now, as of just yesterday when I checked the national data, that's well over 930,000 COVID-related deaths. So that most certainly is significant as far as a disease, a virus impacting just one nation, not to mention the entire world.
Okay, thanks. Another question something I'm curious about, since so much of this policy that we've been discussing this morning, City of Asheville policy, is related to preventing the spread of COVID-19. Can you talk about the difference between the way an unvaccinated person who's contracted COVID, maybe asymptomatically, spreads the disease versus a vaccinated person who's contracts COVID-19 asymptomatically, spreads the disease? It seems like I've been reading that the viral load for vaccinated people can be somewhat reduced, making their ability to spread the disease, although not zero, less than a vaccinated person. Do you have any, has the CDC or any other public health agency spoken to this viral load issue between vaccinated and unvaccinated people?
There's actually quite a bit of study and articles out there around sort of that viral load. And it does, depending on the study, kind of vary. What we know, as I said earlier, regardless of vaccination status, if you're infected, there's clearly potential for you to infect others, regardless of your vaccination status. And as some studies have shown a difference in viral load. Some have shown that at the peak, the viral load does appear to be very similar. Some studies have shown that while that viral load may be similar for a vaccinated person, that viral dissemination or that viral shedding type of thing, because of the vaccine, there's this sort of, the vaccine has created these antibodies that then, will be obviously already trying to fight off infection, and that virus, as it's spread, is sort of coated in a way with that, making it, less virulent. But those are just a few studies that I've seen. Bottom line for infection is that if infected, there's potential for transmission. That's why with even vaccinated folks, we tell them, we recommend that if you're a vaccinated individual and you've had an exposure, or if like a household exposure, or if you develop symptoms, it's important for you to monitor your symptoms. It's important for you to get tested, right? And so because we were aware of some of that, and to your earlier point, like that's regardless of vaccination status, that we know that vaccines aren't 100% effective. And so there are going to be folks who are going to have post-vaccination infections, and their level of transmission, if infected, they can spread as well. And so that guidance doesn't stop just because you're vaccinated. If if you have symptoms, if you are exposed to an individual, we would want you to continue to monitor yourself and seek testing if needed.
One last kind of wrap up. Thank you for that. And this City of Asheville policy, to me, it seems very similar to policies that have been implemented across the country by many government agencies, employers, the U.S. military, the federal government, et cetera, the vaccination or test mandate for employees. And I know you're not here to rule on employee policies. You're not an expert in labor law. You're an expert on public health, but oftentimes government officials turn to public health experts to advise them on policies. And I was left a little bit with your testimony this morning is kind of feeling ambivalent. And I'd just like you to just kind of, if you can, go on the record and say, as a public health professional, do you support the City of Asheville policy? Do you think it's a good idea? Do you think it's a good measure to help stop the spread among employees and in our community? Is it something you would endorse? I mean, I'd just like you to sort of take a stand on that if you're able, as our senior public health official in the county.
Thanks for the question. As I mentioned earlier, that guidance and that recommendation is not just at a local level. That's guidance that's included in the CDC, on CDC documentation, and from the North Carolina Department of Health and Human Services for their interim guidance for workplaces and businesses that are public facing. It is strongly encouraged that work sites and employers require vaccination status, and that it is also strongly encouraged in that guidance document that employers have testing for unvaccinated or those who decide not to disclose. And so from that guidance alone, these are seen as recommendations for workplaces that include public health practice in them, right? So for public health, we continue to say that vaccination is our leading tool and our priority tool, and that we recommend that folks who are eligible to get vaccinated. In addition to that, we continue to recommend testing, as I just said, regardless of vaccination status, particularly if you have an exposure or if you have symptoms. And so those are public health, basic sort of public health measures. And those have been incorporated into that guidance for work sites, which are available for all employers to review, and those recommendations are for all employers to consider when implementing or deciding to implement policy.
Thank you very much.
Mr. Webb, do you have any questions?
I don't have any questions. I appreciate you being here today and sharing your knowledge on this. Thanks for being here.
Mr. Eskovitz, do you have any further questions?
Yes, I do. Let me go over my hand. Have you seen any data or heard anything about how unvaccinated patients have placed any additional pressures on our local hospitals in terms of number of beds being taken, and also staffing issues, for example, admission? Has it exacerbated the capabilities of our local hospitals, Mission and others around here?
So for to your first question around the burden of unvaccinated versus vaccinated in hospitalizations, I've referenced some statewide data that is applicable. Our hospitals report into that system just like other hospitals in the state do. That data does show that there is about 70% of the hospitalizations are in the unvaccinated, with much lower percentages in those who are vaccinated, and in single digits for those who are vaccinated with a booster. That grows with the ICU utilization to well over 70% of that utilization has been in the unvaccinated. In particular, for Mission System, I can share with you at the last update where the former CMO joined me for a briefing. At that time, it was overwhelming that in the Mission System, it was overwhelming that the inpatient were unvaccinated. I apologize that I do not remember the exact number he provided, but it was the vast majority were unvaccinated during that time. As far as hospitalizations and burden now, I will tell you today looks very different than it did a few weeks ago at the peak of Omicron. We did have, today, like when we look at the numbers, and this is actually from yesterday because I update those metrics weekly on Monday. Our hospitalizations were about 7% of all inpatient beds were occupied with COVID, which equates to about, I believe the number was, it was over 80. I think it was 84 patients Mission system-wide that were COVID-19. And that is considerably less than the peak, which was just a few weeks ago, mid-January to the end of January, where our hospitalizations had reached just under 200. I believe it was 196 was our peak hospital-wide. And as far as those individual cases, I don't know. I don't have the data, the hospital data that indicates their vaccine status. But when our hospital partners present with us at the community briefing, they usually share that. As I said, at the last briefing where they shared that information, it was still the majority being unvaccinated.
Yeah, and that CMO or Chief Medical Officer, I think, is Dr. Bill Hathaway.
That's correct.
Yeah, who's now head of MAHEC.
Yes.
Yeah. Thank you.
Anything further from any of the other board members? Thank you. Ms. Saunders, I do have a few questions myself. And again, thank you for your time here today. Are there any other, if you know, are there any other vaccinations that employees have to have before they can be hired for the city from any department?
I'm sorry, I can't answer that. I am not aware of other city, like I don't have access to the city policies to know that. And
is it your understanding that vaccinated individuals are much more less likely to have severe symptoms and side effects than the unvaxxed?
That's correct.
Not that they may not have, they would have zero, but it's less likely that they'll have the more severe.
That's correct. Vaccine is showing not only protection against infection, but that protection beyond that, that reduces the risk of severe illness, hospitalizations, and death if you were to be a vaccinated person who becomes ill.
And as part of the public health concern, that not only that people can die of this disease, but they can get sick and that they can get other people sick. And sometimes they can get very sick, requiring hospitalization, ventilation, extended stays in the hospital. Is that correct?
That's correct. The illness, COVID-19 as an illness has a wide range of how it impacts an individual. Some folks have mild illness, others have extremely severe illness that would require medical treatment, even hospitalization, and as you said, may even require ICU utilization with ventilation.
And that's pretty serious. When you're in ICU and you cannot breathe on your own, you have to have assistance in breathing, artificial assistance with breathing, tubes down your throat and things like that.
Yes, that would be considered severe illness.
And do you know how long vaccinations have been around? Wouldn't it be somewhere around 200 years at least?
I'm sorry, can you clarify? You mean just in general vaccines? How long have we?
Yeah, if you know, and roughly, and rough estimate is fine.
Yeah, so thanks for that question. I may not have the exact date of the first vaccine. I do believe somewhere around the 1800s where folks were dealing with smallpox. But the bulk of our vaccines have been developed in the last 100 or so years, particularly after 1900 and beyond, where we've had sort of the most emergence of vaccine, and have a considerable number of vaccines now against viruses and diseases that at the turn of the century in the 1900s were sometimes the leading causes of morbidity and mortality, particularly in children. And now, because of that work around vaccines, we see far less burden of those diseases in our communities.
And is it a factual statement to say with the help of vaccination, some once dreaded diseases like polio are virtually non-existent now? Not 100%, but virtually non-existent now across the globe?
That's correct. Again, as you mentioned, not zero, but there are several vaccine preventable diseases that we rarely see, or if we continue to see them, they're in far fewer numbers than what we saw in decades before. I gave the example of measles previously, and polio is another one that we see far less burden of those diseases, in large part to having vaccines that are effective against them.
And my last question, if you know, has the number of unvaxxed COVID patients needing to be hospitalized had an effect on, locally, had an effect on the ability of the general population being able to access the hospitals for other types of surgeries and procedures?
I'm sorry, I can't speak to that. That would be better suited for one of our hospital partners to answer.
Okay, thank you very much. That would be all of my questions. Again, does anyone else on the board have any further questions?
One more question, if I can.
Mr. Deborah?
Yeah, Ms. Saunders, just could you reflect a little bit about the role that disinformation has played in inducing vaccine hesitancy between many groups in our county, perhaps even present within city employees? And the reason I bring this up is because there was a reference made in your testimony and questions about infertility rates, and also things like death rates, vaccine deaths, deaths from the vaccine, 20,000 deaths. And oftentimes I've noticed that experts like yourself will say, well, there's no data to support that, but that leaves an opening. Like, well, if there's no data to support it, that means there might be, where's your data to say that it's not true? Which kind of puts a little trap in place. Could you just talk about that?
So the goal, and not just of public health, but just the medical community in general, has been to provide reliable and factual data around what we know, not just about vaccines, but just what we know about COVID. And it's been almost 2 years since, while I wasn't employed with Buncombe County at the time, it was March of 2020 when many of the counties in North Carolina began to identify their first cases. And we've learned a lot in those 2 years, and we've relied on the science and the data to help inform the community, not just about vaccine, but about COVID itself, and how much we learned in these 2 years about how COVID, how people spread COVID, what works to help keep it down. And then as that time has gone by, including sort of like how useful testing can be to help prevent the spread and stop that chain of infection. And then of course, with the advent of vaccine, making, part of our job is to make sure that folks have, reliable and trusted sources around the benefits and the risks of vaccine, right? And so we strive as public health and the medical community at large to make sure that the community has that information. And we continue to, when I say we, I'm sorry, the public health department and other public health departments and medical community find different ways and try to figure out different ways to get that message out. And sometimes that's through, our website, sometimes it's through social media, sometimes that's through media partners to help get that story out. Sometimes that's through, working with community voices to talk through some of that information so that we continue to get that that reliable information out to individuals and answer their questions. That's one of the things we also talk about, and with as we interact with the community, is that if you have questions, ask public health. If you have questions, ask your doctor. If you have questions, ask a medical professional that you trust, so that you can get answers to those questions.
Okay, yeah, thanks. I get all that. I guess I'm just, my sense is, and I'm curious as to your view, that disinformation has played a huge role, despite everything you just said. It's overwhelming in terms of the impact, generating fear, concern, questions in the minds of unvaccinated folks. Just talk very briefly about the degree of that challenge that you've been facing as a public health professional.
Yeah, and just I guess really just only provide sort of that anecdotal type of experience as we continue to study. A lot of that may be studied in the rear view as we continue to evolve about like what did messaging, how did messaging impact. But anecdotally, it's from public health, it's really important. I've said it several times that we know that there are tools that can help prevent the spread. There are tools that can help prevent infection. And there are tools that can help us keep people out of the hospital and dying. And those are the things we want folks to hear. And so, it can be a lot of work to try to stay ahead or try to stay at least with information that may not be as reliable. Again, our purpose is helping people have the reliable information that they need to make the best decision for themselves. And, absolutely, during this time, we are confronted with questions often, from community or from individuals that I've heard this, and we just, give them the reliable and trusted information that we can and allow them to inform themselves and educate themselves as much as possible so that they can make the best decision for themselves.
Thank you.
Mr. Escovitz.
One last question, if you don't mind. Are you aware of any communities? Are you aware of any communities either in North Carolina or across the country that have mandated through for their public workers vaccinations, or at least provided exceptions with under testing, religious or medical grounds?
So I don't have a full inventory of what employers have put in place, or even local or state or other government entities. I am aware that others have put, more often it appears, the vaccine verification and testing reflex, as I call it, and even our state government. So the state government, also the North Carolina state government, has that vaccine verification and testing policy as well. And we do have that in Buncombe County government. There's a vaccine verification and testing policy in place. And to my knowledge, there are other local jurisdictions that also have that.
Are there any other board questions? Are there any other questions from council? Or may this witness be excused?
I have no more questions, Madam Chair.
Thank you. Mr. Denton, may this witness be excused?
I have one follow-up question, if that's okay.
Sure.
Ms. Saunders, you were asked about disinformation and how you counter disinformation with reliable data and reliable sources. Did you bring with you today any data to support your contention that vaccinated people have a reduced transmission of COVID?
I did not submit any documentation from any studies for that.
Okay, no further questions.
Ms. Shepherd, thank you again for your time. You are excused.
Thank you all.
And Saunders, I'm sorry, I said Shepherd. I'm sorry.
Quite all right. No worries.
I think I forgot to mention that, just so everybody can know, I think it would be tentatively, we should look at maybe taking our afternoon break sometime between 3 to 3:15 maybe. And we will be breaking today at 4:45 so the board can go into closed session. So that way everybody can maybe sort of, plan accordingly. But certainly if anybody needs a break before 3 or 3:15, just wave your hand and we can take a quick break. If there's no further housekeeping rules, then Mr. Maddox, do you have any further witnesses?
I do, and I see Ms. Barrett is in the meeting. I don't know if she is on camera right now. There she is. The city would like to call Ms. Shannon Barrett to testify, and I believe she was previously sworn in.
She was, and I see her face on a picture, but I do not see her on camera. Oh, okay. I'm told that she will, when she says something, she will pop up.
Okay. Hopefully I'm showing it.
There you are. Ms. Barrett, you are still under oath. Mr. Maddox, the witness is with you.
Sure, if you would just give me 1 second. Get myself situated here. Okay, thank you. Could you please tell the board your name?
My name is Shannon Barrett.
And what is your job title?
I'm the HR director for the city of Asheville.
And prior to assuming that role, did you previously work in the city of Asheville's HR department?
I did. I originally joined the city of Asheville as an HR manager.
And prior to joining the city of Asheville, did you have experience working in the field of human resources?
Yes, I did. I served as the HR director for the city of Marietta, Georgia for almost 6 years.
Okay, and are you a member of any professional associations regarding human resources?
I am. I'm a member of IPMA HR, which is Human Resources Association, National Association focused on local government.
Okay. I believe we know you're qualified. I'm going to jump in to some of the meat of this. In your role as the director of HR for the city, are you responsible for drafting and managing city policies dealing with aspects of personnel administration?
I am.
And does that include, policies such as the city's health plan?
Yes, it does. It includes a variety of policies that impact or support employees.
So I assume that includes policies that deal with matters of employee health and safety?
It does. We often work with risk, but yes, we do help draft and oversee policies that speak to employee safety and well-being.
And as the city's HR director, are you generally aware of when an employee is fired?
I am.
Okay. Do you have copies of the city's exhibits available to you there? The various documents that both parties put in? It might be easier for me to just reference those here rather than trying to share screens, because I've noticed my computer slowing down pretty considerably when I tried to do that. Do you have there a document that's labeled Exhibit A, termination letters?
I do.
Can you open that document and let me know if you recognize those documents in there?
One moment, my computer is not cooperating. My apologies. Give me 1 second. I do have the letters.
Okay. And what are those documents?
So the documents you're referencing are notice of termination that were given to employees involved in this grievance hearing who were terminated for a number of different policy violations.
And what you have there, does it appear to be an authentic, accurate copy of those termination letters?
Yes, it is.
Madam Chair, at this time, I'd move to enter City's Exhibit A, termination letters into evidence.
Have the board members had an opportunity to review those documents, or do you have access to them? Mr. Denton?
No objection.
Hearing no objection, they're admitted.
Thank you, Madam Chair. Ms. Barrett, I note that these employees were fired, each of them, for failing to comply with the city's COVID-19 policy. Did that also constitute a violation of any other city policies?
It did. It also constituted a violation of the personnel policy, specifically the inappropriate personal conduct section.
Did it also constitute a violation of the city's ethics policy?
It did.
Now, I would like for you to, let's first turn to the city's ethics policy, and that is Exhibit K of the city's exhibits. If you could please open that.
Mm-hmm. Okay.
Have that open. I'd like you to scroll down to where it talks about, I believe it's section A, work performance.
My apologies.
Actually, before I do that, let me ask, are you familiar with the ethics policy?
Yes, I am.
And is it a policy that the HR department is involved in the enforcement of that policy from time to time?
Yes.
And does this appear to be an authentic, true copy of that policy?
And Mr. Maddox, I apologize, but the link that I am going to is not pulling up the documents that were originally shared by you. So give me 1 second while I go about this from a different route.
Certainly.
My apologies.
This is why we included 3 days for a hearing.
Exactly. And I do have hard copies, but I want to make sure I'm referencing the same thing that you're looking at, so I'd rather open.
So long as your hard copy has a mark at the top that says Exhibit K on it, it should be the same thing.
All right, I have it now.
Okay. And does that appear to be a true, authentic copy of the city's ethics policy?
Yes.
At this time, Madam Chair, I move to introduce City's Exhibit K, the city's ethics policy, into evidence.
If any of the board members have not received Exhibit K, let me know. Okay, Mr. Denton,
No objection.
hearing no objection, Exhibit K is admitted.
Right, now that's in evidence. I wonder if you could scroll to the portion of that policy labeled A, work performance.
Mhm.
And is it your understanding that, well, there's a section there that says requirements. Are those requirements that apply to city employees?
Yes.
And if you look down at requirement labeled number 2, would you mind reading that for me?
Label number 2 says not engage in disorderly conduct, horseplay, sexual activity, insubordination, and illegal activities.
That is at the top of that, it says while on duties, employees will, and then not engage in those things. And insubordination is included in there. That's correct?
Yes, that's correct.
Okay. So I would now like you to turn over to City's Exhibit I.
Mhm. Okay,
You have that open?
I do.
Does that appear to be a true and authentic copy of the pages from the city's personnel policy?
Yes, it does.
And Madam Chair, at this time, I would move to introduce City's Exhibit I, pages from the city's personnel policy into evidence.
No objection.
Thank you, Mr. Denton. Of all of the members of the board had an opportunity to have received that. The city's Exhibit I is moved into evidence.
And Ms. Barrett, I'd like you, if you could, scroll to the section that's labeled Section 61, that's labeled Inappropriate Personal Conduct Defined.
Yes.
Would you read me the paragraph that falls just underneath that heading?
Mm-hmm. Yes, so inappropriate personal conduct is behavior of such a detrimental nature that the functioning of the city may be impaired, the safety of persons or property may be threatened, or the laws of the government may be violated. And then there are examples that are provided beneath that.
And I would like, if you could, to read me example L.
Mm-hmm. Example L, example L states manifest signs of insubordination towards a superior officer, in parentheses, resistance to orders or rules.
Thank you for that. So these employees were terminated for failing to abide by policies, and that constituted inappropriate personal conduct under this policy. Is that correct?
Right.
Objection.
You're right. I was leading. I apologize. And I'll rephrase.
Rephrase your question.
How to rephrase this? Were these employees fired in part for violating these policies?
They were fired in part for violating the COVID.
I'm sorry, Ms. Barrett, Mr. Denton, did I hear an objection?
Yeah, I mean, it's another leading question. All he has to do is just ask her why they were terminated.
Rephrase your question, Mr. Maddox.
I'll do it this way. Ms. Barrett, do these employees' termination letters set out why they were terminated?
Yes, the letters do specify why they were terminated.
Were some of those employees terminated for violations of these policies?
They were terminated for violation of the personnel policy as well as the ethics policy, and in some cases, additional departmental procedures.
Departmental policies as well as these citywide policies.
Correct.
And those are outlined in the employees' termination letters as well?
They're outlined in each individual letter.
Okay. Are you familiar that the parties in this case have entered into stipulations?
Yes.
Certain stipulations. They've stipulated certain evidence.
Yes, I'm aware.
Do you have a copy of the written stipulations in front of you?
I do.
Can you open that up for me?
Mm-hmm. Okay.
If you could you read to me stipulation number 6?
Stipulation number 6 states, all grievance were released from city employment after they willfully refused to comply with the interim COVID-19 employee safety policy, updated COVID protocols and guidelines.
Okay, so I'd now like you to take a look at City's Exhibit B.
I'm sorry, did you say D?
I said B as in boy.
Oh, B as in boy, thank you.
If you could open that up for me, I'd appreciate it.
Okay,
And are you familiar with that document?
yes.
What is that document?
This is a copy of the interim COVID-19 employee safety policy.
Does that PDF that you have there also include the protocols and guidelines?
It does.
Are those protocols and guidelines referenced in the overarching
Yes.
interim policy?
Yes.
Madam Chair, at this time, I move to introduce City's Exhibit B, the city COVID policy and protocols and guidelines.
No objection.
Thank you, Mr. Denton. Anyone on the board not have their copy of Exhibit B? Exhibit B is admitted into evidence.
So going back, would you read that stipulation number 6 one more time for me?
Sure. Stipulation number 6 says that all grievance were released from city employment after they willfully refused to comply with interim COVID-19 employee safety policy, updated COVID protocols, and guidelines.
And what is your understanding of that stipulation?
My understanding of that stipulation is that the grievance have stipulated that they were indeed released from employment with the city because they violated these policies.
Okay, would you do me a favor and read stipulation number 7?
Stipulation number 7 says grievant employees further stipulate that they acted insubordinately and willfully failed to follow city and departmental policy as set out in their termination letters. But such stipulation does not constitute an admission that grievant employees' conduct threatened the safety of persons or is detrimental to the functioning of the city.
Now, the portion of that stipulation that says they do not admit to their conduct threaten the safety of persons or is detrimental to the functioning of the city, is threatening the safety of the city and detrimental to the functioning of the city a component of inappropriate personal conduct?
Yes, it is. It's in the policy.
And is threatening the safety of persons or being detrimental to the functioning of the city, is that important to a finding of insubordination under the ethics policy?
Yes.
Is it? Does the ethics policy say that insubordination is not allowed only if it's detrimental?
No, actually, the ethics policy does not put any stipulations around insubordination.
So insubordination is insubordination not allowed under the ethics policy, even if it's not detrimental to the function of the city or threaten the safety of others?
Correct.
Would you please read stipulation number 9 from the document that's in front of you?
Stipulation number 9 states, the city afforded grievance adequate due process in relation to their release from employment with the city of Asheville and complied with all relevant policies and procedures, including but not limited to Asheville City Code, Chapter 2, Article 4, Division 3.
And what is your understanding of that stipulation?
My understanding of that stipulation is that the city followed all of its processes and procedures in relation to the termination of these employees, that they were afforded due process, and and we followed all of those guidelines.
And by stipulating to that, are those employees admitting that is the case?
That's my understanding of the stipulation, yes.
Thank you. Are you familiar with the Civil Service Board's substantive rules?
I am.
And if you could, would you open up City's Exhibit J?
Yes.
Can you tell me what that document is?
This is a copy of the Civil Service Board substantive rules.
Does that appear to be a true, accurate copy of the rules as they were passed by the Civil Service Board and approved by the City Council?
Yes, it does.
Madam Chair, at this time, I'd move to introduce Civil Service Board Substantive Rule 1 into evidence.
No objection.
Assuming all of the board members have access, it's entered into evidence.
Thank you, Madam Chairman. Ms. Barrett, if you would turn your attention to Section C, Grievance Hearing Standards, would you read for me Section C1?
Section C1, for purposes of determining whether a complaint of employment action is justified, the city must demonstrate that the decision complained was just, right, or valid.
Great. And would you read me section C2?
C2, an employment action is per se justified upon a showing that an employee violated a city or departmental policy, rule, or code of conduct and received due process as defined by this rule.
So based on these documents, did these employees admit to violating city policies?
Yes, that's my understanding.
And did these employees admit that the city afforded them due process?
Yes.
Great. I'm going to put this aside now and turn a little bit more toward the policy. Did you have the opportunity to hear Mrs. Saunders testify earlier?
I did.
Great. And are you a public health expert?
No, I am not.
And you testified earlier that the city's HR department is responsible for administering the city's health plan. Is that correct?
That's correct.
And that HR is in charge with drafting, implementing, enforcing other policies touching on employee health and safety. Is that correct?
That's correct.
And does the city employ any healthcare professionals?
Yes, we do. We actually are fortunate to have an employee health center. And in that center, we have medical professionals. We have a part-time physician, as well as a physician assistant and medical assistant as well.
And is that staff available to you to consult on matters regarding employee health?
Yes, they are.
So given your role with the city, what kind of involvement in planning and implementing various measures intended to adapt the city's operations to COVID-19 have you had a part in?
I've had a part in most of those actions.
And has COVID-19 had a negative impact on the city's operations?
Yes.
Could you tell me a little bit about that?
Certainly. Beginning in March of 2020, as soon as the city, following guidance from the state and Buncombe County, the city made the decision to close our facilities and to send employees home, as many as possible. So we had to pivot very quickly. March 17th, we asked all employees who could to work from home. We limited the number of frontline employees as much as possible. Because of the nature of the work that we do, the nature of the services we provide, there are just some employees that had to report, police, fire, sanitation. But we made every effort to limit the number of employees that had to be actually out in the public or in the work site.
And besides moving as many workers as possible to telecommuting, did the city put in place other measures? We did, because we knew that certain employees would not be able to work remotely. The city put in place an administrative leave policy that provided ongoing payment to employees who were not able to work either remotely or in the field. And as public health guidance evolved, did the city adopt other measures such as masks? We did. Again, following the guidance, we put in place masks. We followed Buncombe County's mask mandate, and so required employees to wear masks in city facilities or vehicles anytime there was not the ability to socially distance. We also implemented other protocols, enhanced cleaning, markers indicating what a safe space is inside of city buildings, barriers, everything that had been recommended. Now, you mentioned that you were paying attention to things from public health officials. Did that include information coming from the CDC? Yes, absolutely. And were you paying attention to updates and guidance coming from the Buncombe County Health Department? Yes, we relied very heavily on the Buncombe County Health Department. Were you looking? As well as the North Carolina Department of Health and Human Services. Did you look at any guidance from OSHA by any chance? We did. We tried to access all information we could from trusted healthcare agencies. Now, from a process standpoint, when it comes to deciding which measures to implement and which ones to apply citywide or which ones to apply department-wide, are department directors primarily responsible for the conduct of their departments?
Objection, leading.
Who runs departments?
Rephrase that. Can you just rephrase it, Mr. Maddox?
Who runs various city departments?
Department heads run their departments.
And those department heads, do they report to someone?
They do. They report to the city manager.
Okay, and do you report to the city manager?
I report to an assistant city manager, and I should have said, we have a city manager who oversees all of our employees. And within that structure, within the city manager's office, there are also assistant city managers. And so that reporting structure goes up to the city manager through an assistant city manager.
Of course, thank you for that clarification. So from a policy drafting standpoint, does HR research various strategies and present them to the city manager to review and approve?
We do.
And was that what the city was doing with regard to these various protection measures?
Yes, we had a number of conversations with the city manager. We also talked with assistant city managers. We continue to reference the CDC, as I mentioned before, the North Carolina Department of Health and Human Services, Buncombe County, OSHA. We also looked to what other jurisdictions, what other municipalities were doing across the country for examples of best practices. And we spent a lot of time analyzing and trying to decide what was the best course of action for the city.
So we heard testimony earlier that vaccines became available in late December of 2020.
Mm-hmm.
And as they became available, did the city encourage its employees to get vaccinated?
Yes, we did. Absolutely. As soon as they became available, we did everything we could to make information available to our employees. We created, throughout the pandemic, there's been a dedicated web page within our intranet focused on COVID. And it's a resource hub for all information related to COVID, not just the vaccine, but everything else that related to COVID and our policies. We also made sure that employees had access to information from Buncombe County on availability of vaccinations. We allowed employees to get vaccinated on city time, so they wouldn't have to take their own time or own leave to go and get vaccinated. We also held a virtual meeting with some of the staff that I referenced earlier from the Employee Health Center, giving employees an opportunity to ask questions directly of medical providers. We provided on-site vaccination opportunities for some departments, and again, did everything we could to provide information and make opportunities for employees to receive the vaccination.
And so the city decided to encourage vaccinations. Was this based on guidance you were receiving from those agencies we discussed earlier?
Yes, it was.
And were you doing deep dives into the information behind those recommendations? Were you accessing every single study that was coming out about COVID?
No, I was about to answer that. I relied on the expertise of the agencies that we were referencing. I was relying on the expertise of the CDC and Buncombe County, again, the trusted medical providers and medical or public health professionals to do that level of research.
So vaccines, did they become available in the spring of 2021 widely?
Yes, widely.
I'm sorry, was that something? Okay.
I'm sorry, Mr. Denton, did you object?
Yeah, it's a leading question.
Can you rephrase it, Mr. Maddox, please?
I can certainly rephrase it. Ms. Barrett, when did vaccines become widely available to the public and to city employees?
They became widely available in the spring, as early as April. And there were various, you'll probably remember, there were various groups that were allowed to receive vaccines depending on different circumstances. But by spring, by late April, they were widely available for everyone who at that time was age appropriate and they were approved for.
Now, turning back the clock a little bit to the summer of 2021, do you remember if the number of COVID-19 infections in the community was rising or falling?
They were falling at that time.
Had they initially fallen after the first wave of vaccinations?
That was my understanding.
That's another leading question.
I asked, were they falling?
Yes,
prior to that?
they were falling.
And go ahead, Mr. Maddox.
Yes, ma'am. So you said that the number of infections in the community were rising. Did the city manager ask you to explore further options to increase worker safety with regard to COVID-19?
So in the summer of 2021, we initially saw cases falling, and then in July, we started to see an uptick. By the end of July, numbers were increasing dramatically in Buncombe County, and in August, we were very concerned again because we were starting to see, even in our employee population, an increase in positive COVID cases. So yes, the city manager did ask for recommendations on actions that we could take to try to help mitigate.
In addition to those rising numbers, were you hearing from city employees with respect to returning to work?
Yes, in the summer we started to talk about opening up again and had more employees that were starting to return to the workplace. And as we saw the numbers of positive cases increase, we started hearing from anxious employees who were concerned about being in an environment with unvaccinated coworkers potentially.
Objection, that's hearsay.
And she's testifying to her understanding of things at the time.
She's testifying to what employees told her, and they're not here to testify. That's hearsay.
I will sustain the objection.
I'll withdraw the question. So the city manager asked you to put in place or to explore additional measures the city could take to protect its workforce. Is that correct?
That's correct.
And what did the city ultimately land on as a matter of policy?
We discussed at one point a number of different things. Where we landed was continuing to strongly encourage vaccines and ask employees to provide proof of vaccination. And if they could not provide proof of vaccination, then we asked that they provide evidence of a weekly COVID test.
And are the requirements that you just set out, is that set out in that policy document we looked at earlier?
It is.
And that was city's exhibit B?
Mm-hmm. Correct.
Does that policy document lay out the consequences if an employee fails to provide proof of vaccination or submit the results from a negative test?
It does.
And what are those consequences?
The consequences for not providing either the vaccination verification or weekly testing, there are different levels of the consequence. First occurrence, an employee will receive a written warning. The second occurrence, they will receive a final warning and a 5-day suspension without pay. And the third occurrence is termination.
Does the city pay? No, I understand. The policy requires employees provide proof of vaccination or the results of a negative COVID-19 test each week. Does the city pay for tests?
The city does not pay for tests. However, we are fortunate because there is a free testing site located in one of the city facilities. This is in partnership with Buncombe County. Any employee has access Monday through Friday to free testing at Harris Cherokee.
And at times when those free testing sites have been unavailable due to inclement weather or for other reasons, has the city afforded employees additional time to obtain a test?
We have changed the.
That was as question as I can ask.
You're including a lot of information in your question, so you're kind of testifying. So an open-ended question would be appropriate.
Did you have any further questions, Mr. Maddox?
I'm sorry, Madam Chairman, could you say that one more time?
I'm sorry, did I understand you to say you don't have any further questions?
No, I do have further questions.
Okay, what was the last part you said right before Mr. Denton spoke?
I said I'm asking her a very simple question. I provided her some context.
Oh, okay. I'm sorry, that was the part I didn't catch. Objection is overruled.
No, I'm sorry.
Can I give you the question again?
Please.
Yes.
At times when those free testing sites have been unavailable due to inclement weather or for other reasons, has the city afforded employees additional time to obtain a test?
Yes, we have altered the schedule when there's been inclement weather or other issues like holidays or the free testing site was closed to make sure that employees had ample time to have access to a test.
To the best of your knowledge, have any city employees been disciplined for failing to provide a test at a time when free testing was not available?
Not to my knowledge.
Under the policy, what kind of tests will the city accept?
The city will accept a variety of tests, and Ms. Saunders discussed earlier the two types that are most common. One is the PCR test. The other is the rapid or the antigen test, and we will accept either of those.
And are those generally available for free in the community?
There are now free at-home rapid tests that are available through the federal government. Again, the free testing site has been available throughout the entire time we've requested weekly testing.
And to the best of your understanding, are those tests 100% accurate?
I'm not a medical expert, but to the best of my understanding, no, they're not.
Then why does the city require them if they're not 100% accurate?
They're like a lot of other tests. They may not be 100% accurate, but they are relatively accurate, and they provide a good baseline for understanding whether or not, for knowing whether or not someone is positive. And they're widely accepted in the medical community.
Does the city require testing for vaccinated employees?
It does not.
And I think we heard Ms. Saunders testify earlier that, well, I mean, let me ask in this way. To the best of your knowledge, when someone is vaccinated, are they instantly immune to the disease?
As I understand it, they're not immediately immune. However, I don't know that I have seen any real clarity around exactly when that immunity occurs. And our understanding is that once someone has been vaccinated, the immunity does start to build. And so they're on that path to gaining immunity.
If that's the case, why does the city not require testing for a period of time after a person is vaccinated?
That was a middle ground we landed on. Again, our goal was to encourage employees to be vaccinated, and also our ultimate goal is to try to mitigate as much as possible the risk of an employee getting or being exposed to COVID. And once someone is vaccinated, everything we have seen from the CDC and Buncombe County and all of the other experts is that vaccination does provide a level of increased immunity to COVID.
Could the city have included a requirement that vaccinated employees be tested for a period of time?
We could have. We also could have mandated vaccines, but we chose to go with this approach, and again, to try to find a middle ground.
Now, just based on your understanding, why did the city choose this approach to require proof of vaccination and testing for unvaccinated folks?
This approach offered employees a choice. It was not a mandate. It was not a one requirement. It is a process or a policy that allows an employee to choose which path they want to take.
So does, if employees are, have a disability under the Americans with Disabilities Act and requested a reasonable accommodation from having to comply with this policy, does the HR department have a process to handle that?
We do. We have a reasonable accommodation process in place that we use for a variety of reasons. It's applied across the organization for a number of different scenarios. Any condition that would prevent an employee from being able to work, we would apply the reasonable accommodation process. We would engage in an interactive process with them and better understand and attempt to find an accommodation.
And does the HR department have guidelines for assessing reasonable accommodation requests?
We do.
And if you would look at City's Exhibit E, you open that up for me?
Okay.
Mr. Maddox, was that E as in Eddie?
E is in Eddie.
Okay. Does everyone have that? Okay, go ahead, Mr. Maddox, thank you.
Ms. Barrett, are you familiar with that document?
Yes, I am.
And what is that document?
This is a copy of the reasonable accommodation guidelines.
And does that appear to be a true and accurate copy of the reasonable accommodation guidelines?
It does.
Madam Chair, at this time, I move to introduce the City's Exhibit E, reasonable accommodation guidelines, into evidence.
Has everyone on the board had a chance to look at it or have access to it? Mr. Denton?
No objection.
Thank you. It's admitted.
Ms. Barrett, to your knowledge, did any of the grievant employees in this matter request a reasonable accommodation with respect to the COVID-19 policy?
Not with respect to COVID, to my knowledge.
Does the city have a policy in place with respect to granting religious accommodations?
We do.
And does that policy apply only to the city's COVID policy, or does it provide for exemptions from any policy?
It applies to any policy.
So if I would give you a hypothetical by way of illustration, if there's a uniform standard and a person had to wear certain garments as part of their religion, would that be the avenue for them to request an accommodation or
Yes.
an exemption from that policy?
For religious reasons, yes.
Okay. Did the city have a written religious exemption policy in place prior to October of 2021?
We did not have a written policy in place prior to that.
However, did the city receive very many requests for religious exemptions prior to then?
We did not.
And when the city started receiving those, did the HR department decide to put in a written policy?
We did.
And if you would open up City's Exhibit C, tell me if you recognize that document.
I do.
What is that document?
This is a copy of the religious exemption policy.
And does it appear to be a true and accurate copy of that policy?
It does.
Great. Madam Chair, at this time, I move to introduce City's Exhibit C, the city's religious exemption policy, into evidence.
No objection.
Thank you, Mr. Denton. I assume everyone on the board has had a chance to, or has access to it? Thank you. It's so admitted.
Now, Ms. Barrett, to your knowledge, did city employees request a religious accommodation from the COVID policy?
We did have some requests.
Did those employees request accommodation from the vaccine? What was the form of those requests?
We had employees who requested an exemption from the vaccine. However, we did not grant those exceptions because we do not have a vaccine mandate.
Were those employees under the belief that the city does have a vaccine mandate?
That was the
Objection, it's just leading.
What was the nature of those requests?
employees were asking for a religious exemption based on, from the vaccine mandate. Or from a vaccine.
Does the city have a vaccine mandate?
But we do not have a vaccine mandate, no.
Does the city have a vaccination or testing requirement?
We do.
Were any employees granted an exemption under this policy for religious reasons?
Not to my knowledge, no.
If an employee has a medical condition that might put them at a greater risk from side effects from a COVID vaccine, are they required to take the vaccine or be fired?
No, they could ask for a medical exemption, or we could go through the reasonable accommodation process.
Well, are they required to be vaccinated?
They're not, no one's required to be vaccinated.
Could they take a test?
They could take a test.
And if some reason they are medically unable to take a COVID test, would they be able to utilize the reasonable accommodation process?
They could, yes.
And again, to the best of your knowledge, did any of the employees in this matter request a reasonable accommodation in connection with this policy due to disability?
Not to my knowledge, no.
I'd like to go back to August of 2021 and talk about the HR department knew at that time. At that time, are you aware of any guidance from federal regulators such as OSHA regarding protecting employees in the workplace?
Yes, at that time, OSHA had issued guidance, and at the time, it looked like there might be actual federal guidelines that would be issued regarding workplace safety and COVID. And part of the information that was coming out at that time really was speaking to establishing policies around vaccine verification and or testing.
I'd like you to take a look at City's Exhibit G. Let me know when you got that open.
Okay. All right.
Do you recognize that document?
I do.
Can you tell me what it is?
This is information from OSHA, from the Occupational Safety and Health Association, protecting workers, guidance on mitigating and preventing the spread of COVID-19 in the workplace.
Madam Chair, at this time, I move to introduce City's Exhibit G, which is OSHA guidance on mitigating and preventing the spread of COVID-19 in the workplace and evidence.
I don't think a foundation has been laid that she is familiar enough that this is a true and authentic copy. I just don't think there's a foundation that gets us into evidence through this witness. I mean, she doesn't work for OSHA. This is not a CDC document that they relied on.
Mr. Maddox, want to ask a few more questions?
Ms. Barrett, are you familiar with this document? Have you seen this document before?
I have.
Is this one of the documents that the city reviewed in connection with determining whether to implement a COVID testing or proof vaccination policy?
It is.
Have you accessed this document before this date on OSHA's website?
I have.
Again, I think that it provides more than enough authentication for purposes here.
Have all the board members, everyone on the board have access to the document? Hey, Mr. Denton, do you wish to be heard?
Yeah, I mean, this document is hearsay. There's no testimony that this is a true and authentic OSHA regulation.
I didn't say it was a regulation. I said it was a guidance document that the HR department relied upon.
So simply because the HR relies upon a document does not get it into evidence.
It's not hearsay, it's affecting the listener.
So you're offering this not for the truth of what is in the document. You're offering this for the effect it had on the HR department?
If this caused the HR department to it was at least partially a reason why the HR department put in place this policy, sure. If that's gonna.
And the document is in evidence.
Thank you. Ms. Barrett, I'd like you to scroll down to the bottom of page 5 of that document, 5 of 12.
Okay.
The paragraph that goes from page 5 onto page 6. Right there where it says number 1. Or actually, the heading of that section, could you read about halfway up page 5? Could you read what that says?
The roles of employers and workers in responding to COVID-19.
That's correct. And then under number 1 down there, could you read me that paragraph?
Number 1, facilitate employees getting vaccinated. Would you like me to read the entire paragraph?
From the sound of your voice, it sounds like you don't want to.
Oh, no. Employers should grant paid time off for employees to get vaccinated and recover from any side effects. The Department of Labor and OSHA, as well as other federal agencies, are working diligently to ensure access to COVID-19 vaccinations. CDC provides information on the benefits and safety of vaccinations. Businesses with fewer than 500 employees may be eligible for tax credits under the American Rescue Plan Act if they provide paid time off from April 1st, 2021 through September 30th, 2021 for employees who decide to receive the vaccine or to accompany a family or household member to receive the vaccine and to recover from any potential side effects from the vaccine. Employers should also consider working with local public health authorities to provide vaccinations in the workplace for unvaccinated workers. Finally, OSHA suggests that employers consider adopting policies that require workers to get vaccinated or to undergo regular COVID-19 testing, in addition to mask wearing and physical distancing if they remain unvaccinated.
Thank you. Would you mind reading me that very last sentence again?
Yes. Finally, OSHA suggests that employers consider adopting policies that require workers to get vaccinated or to undergo regular COVID-19 testing, in addition to mask wearing and physical distancing, if they remain unvaccinated.
Now, we said before, this is a guidance document. Did OSHA previously mandate that employers of above a certain size put in place a policy like this?
They did for a period of time.
And do you understand that in late January, that policy or that requirement was struck down by the United States Supreme Court?
Yes.
Do you know? Are you aware of the Supreme Court's ruling on that OSHA requirement?
Yes.
Do you know if OSHA still recommends that employers adopt policies such as this?
Yes, it's my understanding that OSHA still has these recommendations in place.
And is the understanding that other public health agencies and agencies concerned with worker safety still maintain that this is an effective policy?
Yes.
At this time, I have no further questions.
I have some questions, if that's okay.
Thank you, Mr. Maddox. Mr. Denton, witnesses within.
Picking up on that OSHA regulation, Ms. Barrett, are you aware of the reasons the Supreme Court and federal courts struck down an identical policy to the one the city of Asheville has implemented?
I don't have specific knowledge of the reason behind that, no.
When the city of Asheville implements a policy, is it fair that that policy needs to be clearly articulated to employees?
Yes, that's fair.
And it should be easy to follow and easy to understand?
Yes.
And it should have a clearly defined purpose?
Yes.
And it should be clear how to follow the policy and what the consequences of not following the policy are, right?
Mm-hmm. Yes.
And policies that you put into place for city public servants should be based on data and supported by authoritative sources, right?
There are a number of factors that go into policy development.
Okay, is data and authoritative sources one of those factors?
Yes.
Do you agree that any city of Asheville policy should be tailored to meet its purpose in the least restrictive way?
That's a fair statement.
The policy we're here about, how effective has it been?
Similar to some of the questions earlier for Ms. Saunders, that's a difficult question to answer because we have no way of knowing how many employees may have gotten COVID or how many employees may have had other things happen if the policy wasn't in place.
Earlier, you testified earlier that in July of 2021, you saw an increase in COVID cases in the employee population.
Yes.
How did you know that?
Because we had employees who were reporting that they were positive to Employee Health Services and also to their departments because they were not able to come to work.
And do you record that data?
HR does not record that data.
Does anyone at the city record that data?
It is documented through our timekeeping system. If an employee is out sick or on any type of leave, then that's reported.
Has this policy reduced the spread of COVID amongst city employees?
We have seen, and again, this is difficult to be able to accurately answer because we don't know for certain when an employee is out, the reason that they're out.
Couldn't you ask them to let the city know if they get COVID?
We could have asked them.
And wouldn't that be a good way to document how effective this policy is?
From an HR standpoint, we are careful about HIPAA and maintaining employee privacy around medical conditions.
So you're saying HIPAA prevents you from learning which of your employees are out with COVID?
From an HR standpoint.
Aren't people that get test positive for COVID required to report that?
Through Buncombe County Health, Public Health.
Okay, so that's not a HIPAA issue.
That's not a HIPAA issue.
But are you saying it's a HIPAA issue for the city of Asheville to learn that information?
I'm saying from an HR standpoint, we would not be asking an employee for details about their medical condition.
So, Ms. Barrett, this is a policy, it's been in place for 6 months. At least 5 people have been fired because of the policy. We're now in litigation over the policy. We're probably going to continue in litigation for a long time to come. And your testimony is that you cannot tell us if this policy has even been effective?
Objection.
Basis?
So now you want me to private? It's completely argumentative.
It's cross-examination, John.
Are you
And I'm going to sustain the objection is argumentative. You can rephrase it.
Ms. Barrett, I'll rephrase this. You understand that we are here to, we have a hearing over this policy about the vaccine and the test we've been talking about all morning, right? You understand that?
I do.
And you understand that you testified 5 people have been fired because of this policy.
Correct.
And of course, you understand I represent those 5 people.
I do.
Okay. And so I just want to make sure I understand your testimony is that the city of Asheville cannot tell us if this policy that fired 5 people has been effective at preventing the spread of COVID.
What I can say is that the policy was put in place to help mitigate the risk to our employees and to help reduce as much as possible the spread of COVID.
And did it?
It did, as far as I can tell anecdotally.
Okay, was there any data on this policy being effective?
I don't have any data on this policy.
But the city could get that data if they had said, hey, if you're a city employee, let us know if you get COVID. And you could record that data back starting in September, and then we would know how effective this policy has been, right?
We could, and we have tracked some of that, but again, we've been relying on employees to report.
You could require employees to report COVID diagnosis, couldn't you?
I suppose.
Objection, she's not an attorney. She can't say what employees can be required to do or not with respect to their medical conditions.
Sustain.
Well, that's fair. Ms. Barrett, is that true that you, as HR director for the city of Asheville, cannot require employees to do anything with respect to their medical decisions?
She just sustained my objection on that question.
Sustained.
So, Ms. Barrett, the city of Asheville HR department does not have authority to require a vaccine or test policy? Is that true?
I'm sorry, could you repeat your question?
Well, the attorney for the city just said that you don't have any authority to require employees.
That is not what I said. I would ask you to not state.
Yeah, that is not what he said.
Okay. I'll move on. So, Ms. Barrett, and this is the last question on this issue. The city did not acquire any data that would be able to tell this board whether or not this policy was effective at preventing the spread of COVID. Is that true?
If you're asking, I want to make sure I'm understanding the question you're asking. If you're asking me if we have documented every single employee that contracted COVID, we did not.
And in turn, you're not able to tell us whether this policy has prevented COVID at all.
What I can tell you is anecdotally, what we have seen from the numbers we do have, and again, this is on employees self-reporting, not required to report, but self-reporting, we have seen a steady amount and then a decrease.
Well, we've heard from some of the board members about their concerns about misinformation, and I want to make sure that we don't put out any misinformation here about the effectiveness of this policy. So your own anecdotal observations of COVID cases is not what we would call data or a reliable source of information on this.
Objection, is there a question in there?
Let him finish this sentence, then we'll say.
Ms. Barrett, is it fair to say that your own anecdotal observations of COVID cases does not amount to data or a reliable source to support the effectiveness of this policy?
As I'm not a medical provider or in the healthcare industry, then no, I can't speak to that kind of information.
Can anyone in the city of Asheville tell us how effective this policy has been?
I would have to know better how you're determining effectiveness.
Well, how would you determine effectiveness?
By limiting the spread of COVID and not having large increases in the number of employees who've contracted COVID.
And did it do that?
Anecdotally, it did. It was successful in doing that then.
Based on your own personal observations?
Based on my observation.
Okay, but no data to support that?
I do not have data to support that.
Earlier, you said that part of the basis for any policy should be data and authoritative sources, right?
I said earlier that there were a number of factors that go into policy development.
And two of those are data and authoritative sources.
They can be data and authoritative sources.
So some policies you put into place and they don't require any data at all.
Again, it depends on what kind of data that you're referencing.
Well, in this case, I think it's pretty obvious I'm referencing how many people contracted COVID before and after you instituted this policy so that we can figure out if it's been effective.
Sure. And if you want to talk about data, we did review and we continue to monitor the data that was provided by Buncombe County Health. So looking at the trends for the county, which our employees are part of that population, and watching as the trends rose and recognizing that we needed to put some measures in place to address that based on looking at other resources, CDC, OSHA, again, Buncombe County Health, we chose to put the policy in place to help mitigate the risk to employees of contracting COVID.
Did you hear Ms. Saunders testify that recently, maybe a month ago, we saw the highest number of cases in Buncombe County that we've ever seen?
Yes.
And during that time that those cases were the highest we've ever seen, was this policy to prevent the spread of COVID in place?
It was.
Did your policy have any effect on the high number of cases in the county?
When you speak of the high number of cases, and I know the premise here, we've talked about the goal of reducing the spread of COVID and additionally reducing the impact from COVID. And so while yes, the county did see a large increase in the number of positive cases within the overall population, there were not as many, as I understand it, severe cases. And among the vaccinated individuals that were reported on, or actually the number of hospitalizations that were reported during that time period were primarily unvaccinated individuals.
Well, let's separate the issue of who's being hospitalized, because I think you testified earlier the purpose of this policy is to prevent the spread of COVID, not to prevent hospitalizations, right?
And as a subsequent result of the reduction in spread of COVID would also be the reduction in hospitalizations and the impact on employees and individuals.
But that's not what the policy says. Policy doesn't mention reducing hospitalizations or reducing the burden on our healthcare system, does it?
It does not speak to that specifically.
So going back to what Ms. Saunders testified to, are you testifying that your own anecdotal experiences that city employees had less cases than the county as a whole back when there was a huge uptick in cases?
We saw cases increase from where they had been earlier, but we did not have a massive number of increases. So percentage-wise, our increases were not at the same rate as what we were seeing in the county.
Okay, and so what data are you relying on to testify to that information?
Again, I'm relying on anecdotal information.
Okay, so earlier, and I think this was a very good point, I think Mr. Devereaux pointed out that misinformation can be a real problem during COVID. I want to make sure that we know exactly where you're getting your information because I wouldn't want to misrepresent the effectiveness of something. So you're not relying on the CDC or the Buncombe County Health Department or data within your department when you say that you saw a reduction in cases in your city employees. You're relying on your own observation.
I'm relying on my own observations and also information from our health professionals, our medical professionals at the Employee Health Center.
Okay.
While they didn't provide me with details or individual information, they could provide aggregate information.
What does that mean?
So in other words, the total number of employees that they were aware of. And again, we're relying on self-reporting.
Yeah.
So these would be employees that would report to Employee Health Services that they had tested positive for COVID.
How can you continue to enforce a policy when you don't have any data as to whether or not it works?
Again, we're relying on guidance from the CDC and Buncombe County and North Carolina Department of Health and Human Services, as well as OSHA guidance on best practices.
Has the city of Asheville received any data or studies that policies like this one actually reduce the spread of COVID?
I have not seen any studies.
Would that be important to look for when you decide whether to enforce a policy like this?
I suppose if that information were available, it could have been helpful to inform our decisions. However, we were, again, basing our decisions on the guidance of trusted healthcare professionals.
Well, the guidance is to either get vaccinated or get tested, but it sounds like the guidance that you received did not include any studies or any data that a workplace policy specifically like yours actually reduces the spread of COVID, right?
Objection. Is there a question in there?
Yes, I just asked a question.
No, you asked it, you made a statement.
Well, you interrupted.
Is there a question, Mr. Denton?
Yeah, when he interrupted me, I said correct. I said right. So let's move on. I think we've established that there's no data to support the policy.
Yes, let's move on.
How many vaccinated employees have gotten COVID in the city of Asheville?
I don't have those numbers.
Would that be important to know when you implement a policy like this?
Again, I think that's a difficult question to answer because as Ms. Saunders stated earlier, even vaccinated employees or vaccinated individuals can contract COVID, but there are a whole host of different scenarios that occur there. So I'm not sure that I'm...
How many vaccinated City of Asheville employees have gotten COVID? Do you know that number?
And I answered, I don't know that number.
Okay. How many unvaccinated city of employees have gotten COVID? Do you know that number?
I don't know that number either.
Okay. How many COVID cases have there been in city employees since the beginning of this policy?
Again, I cannot give you an accurate number because we are relying on self-reporting from employees.
Let's look at this policy. I forget what exhibit, I think it's exhibit B. This is the City of Asheville policy. if I could share this. This is already in evidence, so I think I can share this. Can you see this policy here, Ms. Barrett?
Yes.
Okay, and again, I think there were some very good questions from some of the board members about reducing stress on hospitals and reducing healthcare stress. But I just want to make sure that I understand the purpose of your policy. So up here at the top, it says employee responsibilities for preventing the spread of COVID. Is that right?
That's right.
And down here, it says to protect against COVID infection. Is that right?
That's correct.
And down here, it says preventative measures and preventing the spread of COVID-19, right?
Yes.
I don't see anywhere where it says that the purpose of this policy is to reduce hospitalizations or capacity on hospitals.
It doesn't say that.
And right here, it says how long. It says our hope is that these actions will help reduce the transmission of COVID-19. What is that hope based on?
I'm not sure I understand your question.
Well, the city says that it hopes to reduce the spread of COVID-19 with this policy. And I'd like to know what that hope is based on. Is it based on data, or is it just based on cross our fingers and let's hope this works?
Again, this is based on the guidance that we have followed from the CDC and OSHA in particular around workplace safety and guidance for employers, and the recommendations from healthcare professionals that these guidelines would help reduce the transmission of COVID.
And when they gave you those recommendations, no one ever showed you data that it actually has reduced the spread of COVID at any other place, any other workplace, anywhere in the world. Is that right?
Again, when this policy was put in place, and throughout this entire pandemic, circumstances have continued to change, and we've gained new information.
Have you gained new information? Can you change your policy?
We could change our policy. However, the guidance has not changed. OSHA is still recommending this type of measure be implemented in a workplace. The CDC is still recommending vaccination. And as I said earlier, our goal was to provide employees with an option to either have a vaccination or to provide weekly testing.
When will this policy change, if ever?
Again, similar to what Ms. Saunders said earlier this morning, that's difficult to predict.
Are there any guideposts, when cases are a certain way or when infection rates are a certain number that we will change this policy?
We will continue to look to the guidance from, again, CDC, OSHA, Buncombe County. As things change, we will follow new recommendations that come out.
Okay, so there's no and again, I'm just trying to understand for my clients and for other city workers, they may want to know, hey, how long is this going to be in place? Are there any specific guideposts that say, we're going to reassess when this happens? Or for instance, new data comes out. Can you tell us when this will be looked at and changed?
I can't tell you a specific date. I can tell you that we continuously monitor the number of caseloads, the number of positive cases in Buncombe County. We continue to look at what's happening nationally, and we continue to review the guidance from the other medical and healthcare professionals.
Is this policy based on the guidance that vaccinations reduce infection?
Yes, it's definitely based on the guidance that vaccinations have an impact on the likelihood of someone contracting COVID. You know, again, as Dr. Saunders spoke to earlier, we're following the information that vaccinations do help to reduce not only the spread of, but also the severity if someone contracts COVID.
Yeah, and Ms. Saunders didn't have any data to support that vaccinations reduce infection. Have you seen any data that vaccines actually reduce the likelihood of infection?
I haven't delved into studies in depth, no.
But your policy is based on that idea.
Our policy is based on the recommendation of other medical and healthcare organizations.
And at this time, we're gonna take our afternoon break. It's 3:15, let's come back at 3:30. Okay, it is 3:30. It looks like everyone is back. Are we still recording or ready to go?
Yes, we are.
Okay. Thank you, Ms. Bozeman. Mr. Denton, I think the witness was still with you.
Thank you.
Resume?
Thank you, Madam Chair. And Ms. Barrett, I'm gonna try and not take up too much more of your time. I do have a few more questions though, if that's okay.
Yes.
Ms. Barrett, you probably agree with Ms. Saunders that vaccinated people can spread COVID.
Yes.
Okay. If the purpose of your policy is to prevent the spread of COVID, why don't you require everyone to get tested every week?
One, because again, we've been trying to find a middle ground here. And two, at the time this policy was put into place, testing resources were somewhat limited and we had to make a call. And so those that were vaccinated, less likelihood that they're going to contract COVID than those that are unvaccinated. And so
that's based on guidance from the CDC.
Correct.
But you haven't seen data on that. You've just heard the guidance, and Ms. Saunders has referenced that guidance, but we haven't seen any data on that, have we?
We haven't.
Okay. Go on. Sorry to interrupt.
No, that's okay. And again, you know, it's finding that middle ground and where does it make sense? What's reasonable? And it's reasonable to ask people who are not vaccinated to provide a weekly test. That's our way of gauging, of having some information, some data, so to speak. And so we made the decision to not require everyone to provide a test.
There could be city employees who are vaccinated who have gotten COVID in the last 6 months, right?
There could be, yes.
And those city employees who are vaccinated who have gotten COVID could have spread COVID at work, right?
They could have if they were asymptomatic.
Yeah. And if your policy tested those vaccinated people, you could have limited that potential spread of COVID, right?
Potentially.
So testing everyone would actually better reach your goal of preventing the spread of COVID than your current policy.
It could have, but again, going back to what Ms. Saunders said earlier, the vaccines do provide greater protection.
How much greater?
I can't speak to that.
And Ms. Saunders couldn't speak to that either. And is that the reason why you're only testing unvaccinated people, is because you believe vaccinated people are less likely to become infected?
We're doing this again, following guidance and following best practices that have been outlined by other agencies.
Okay, who's more likely to spread COVID as a City of Asheville employee? A vaccinated employee who attends concerts and restaurants all weekend, or an unvaccinated employee who has natural immunity?
Objection.
I can't answer that.
Sustain.
I'm sorry, what's the basis for the objection?
I would say it's sustained. I'm not going to delve into it any further.
Madam Chair, I'm confused where if I need to rephrase a question, I just need to know where I've slipped up. So what's the evidentiary issue with what I asked?
That would be outside of, that's a medical question. That would be outside the knowledge of an HR person.
She just testified that vaccinated people are less likely to spread COVID. And now I'm asking her questions about who is more or less likely to spread COVID. She's opened the door to that testimony.
And the objection is sustained.
Does your policy account for the fact that some people have natural immunity, Ms. Barrett?
It does not.
Does your policy account for the fact that some people work alone?
It does not.
Does someone working alone in a vehicle all day have the same likelihood of spreading COVID as a vaccinated person?
I can't speak to that.
What about, do you have some at-home workers in the City of Asheville?
We do.
Are at-home workers any risk at all of spreading COVID?
I can't speak to that.
Do you agree that different employees have different susceptibility to COVID?
not being a
Objection,
medical person.
could you clarify what you mean by susceptibility?
Madam Chair, is there a ruling on the objection?
Can you clarify the question?
Yeah, sure. When I ask, do you agree that there's a different susceptibility to different employees for infection with COVID? I'm asking, are different employees, do they have different likelihoods of spreading COVID based on their specific job?
I suppose that could be true.
But your policy doesn't account for that, does it?
It does not.
Okay, and earlier I asked you if you knew the reasons, you had testified under direct examination that the Supreme Court had knocked down an identical policy to the one you've implemented here, right?
Objection, that is not what you testified to.
Well,
Rephrase your question.
are you aware of the Supreme Court's position on the vaccine and test policy implemented by President Biden?
I'm aware that there was a ruling.
Do you know what that ruling was?
I know that they struck down the original guidance.
And that was the OSHA guidance. And that was actually struck down since the date of that OSHA guidance that you testified to earlier, which was in August, right?
Yes. However, that guidance still stands. OSHA is still providing that same guidance.
Right, I understand. But you also understand that the Supreme Court struck down that OSHA guidance or that OSHA regulation.
Yes.
Okay. And I asked you if you knew why they struck it down, and I think you said you didn't know why. Is that
Correct.
right? Okay.
Yes.
Let me read you what the Fifth Circuit federal court said about a policy that is identical to the one we're here about today. The Fifth Circuit said, rather than a delicately handled scalpel, the mandate, which is the same as yours, is a one-size-fits-all sledgehammer that makes hardly any attempt to account for differences in workplaces and workers that have more than a little bearing on workers' varying degrees of susceptibility. Let me read you another quote from the Fifth Circuit about
Objection, is there a question in there?
Yeah, I'm going to read 3 quotes and I'm going to ask her if she has any.
Can we break that up a little bit?
Yes.
Okay.
That's compound.
Ms. Barrett, as HR director for the city of Asheville that has implemented an identical policy.
Objection, I just have to categorically object to him telling us an identical policy when he is talking about something that is not a policy. It was a mandate that OSHA put in place. What we are talking about is a city-imposed policy. OSHA put in place a mandate, which is completely different.
I would sustain that objection.
Ms. Barrett, are you aware of the elements of the mandate that President Biden put in under OSHA?
Yes.
Okay, so you're aware that part of that mandate was to require vaccines or require a weekly test for employees if there is more than 100 employees in the workplace, right?
Yes.
Okay, is that the same as the policy that the city of Asheville has implemented?
The city has implemented a policy that does have those same requirements.
Okay. Do you have any concern that a federal court has described that policy as a one-size-fits-all sledgehammer that makes hardly any attempt to account for differences in workplaces?
In our case, we have to work with the resources we have. And I appreciate the sentiment. In our case, we have limited resources and we're trying to put into place policies that are going to have the least negative impact and to strike a balance.
The federal Fifth Circuit also said that the mandate is staggeringly overbroad. It fails to consider what is perhaps the most salient fact of all. The ongoing threat of COVID is more dangerous to some employees than to other employees. The mandate fails almost completely to address
I'm
or
going to
even
object
respond
to
to
this
this
again,
reality and common sense.
because we're talking about something that has no relevance here. A requirement that OSHA put in place for certain businesses is not the same as a policy that the city has put in place.
She just testified.
You're talking about the mandate as if it's the same thing.
Council,
It's not.
council, Mr. Denton, Ms. Barrett is not an attorney. So what she knows or thinks of something a court did, I'm trying to understand how that's relevant to what this board is charged with determining.
Sure, it's relevant for two reasons. First of all, she testified on direct examination that she was aware that the Supreme Court struck down the OSHA mandate.
She did, and she said she didn't know why.
Yeah, and so she has opened the door through direct examination. Mr. Maddox asked her about the Supreme Court's decision. So they have opened the door to me asking about the elements of that decision. That's the first reason.
She didn't know why, Mr. Denton. You can ask her if she knows about these, but she also testified that she didn't know all of the particulars of it.
Yeah, and now as a HR director who made a decision to implement the same policy, I'm asking her if she agrees with the reasons why the highest court in our land struck down the same policy she's implementing.
Can you
Again,
explain
I have to
to me how
object.
that,
You've
Mr.
been
Maddox, excuse me, Mr.
Sorry,
Maddox, can you
I
explain
apologize.
how that's relevant to what this board has to decide today?
Ms. Barrett testified on direct examination that she, amongst other people with guidance from various health administrative bodies, made the decision to implement this policy to prevent the spread of COVID. So I'm asking her if she has any concerns that federal courts are saying this policy doesn't make any sense. So it goes to the purpose of the policy, it goes to the effectiveness of the policy, it goes to the reasoning behind her testimony that she put this policy in place.
But you understand that this board is not the policy review board.
Her direct examination talked about the policy and why they put it in place. And so she has opened that evidentiary door and I'm allowed to explore it.
My question is, do you understand that this board is not here to decide whether the policy was right or not? Do you understand that?
I understand that, and if direct examination did not address those issues, I think you are correct. I would not be able to ask these questions, but they opened the door. I mean, the reason I'm saying they've opened the door is because you can't allow them to ask questions on this issue and then not allow me to ask questions on this issue because it's irrelevant. They made it relevant in their direct examination.
A question was asked by you if she knew about the Supreme Court case. She said, yes, she knew about it. She didn't know all of the particulars. So asking her about every case that may have come out recently on this topic when she's not a lawyer and not aware of the particulars of the case, how is that relevant to what this board has to decide?
It's relevant because direct examination talked about those issues and opened the evidentiary door. If they ask questions on direct, I'm entitled to cross on any of those.
I'm going to give you a little bit more leeway, but just understand not much.
Madam, may I be heard on this issue just
Mr.
briefly?
Maddox?
I asked whether she was aware that the Supreme Court has struck down a mandate from OSHA that required employers of a certain size to put in place a policy like this. And Mr. Denton has decided that that little crack to talk about a very specific mandate has given him the ability to basically testify and to read whole portions of a case that is not the same case and to characterize that mandate, which is something different from our policy, as the very same thing. When he says that they're talking about this thing as a sledgehammer, they're talking about the mandate to apply that to industries broadly and not talking about the decision of an individual employer to implement a policy like this. It is using the idea of opening a door in order to blow a hole in the side of this thing. And I'll leave it there.
And I would have to agree with Mr. Maddox, Mr. Denton. If you have a couple of more basic questions to ask Ms. Barrett, that's fine, but I have to agree with Mr. Maddox's characterization.
Ms. Barrett, this is the last question. Can you tell the Civil Service Board why the city's policy that the Supreme Court describes as a blunt instrument and the Fifth Circuit describes as staggeringly overbroad should be the basis for terminating my 5
Objection sustained. Rephrase your question.
Ms. Barrett, there was a recent year in review that the city of Asheville put out where they stated that in September, the city aligned with federal guidance of having employees vaccinated or tested weekly. Do you recall that?
Yes, I do.
Okay. Is the city still aligned with federal guidance on having employees vaccinated or tested weekly now that OSHA mandate has been struck down by the Supreme Court of the United States?
We're still aligned with OSHA's guidance.
Okay, but you are not consistent with the legal precedent set by striking down OSHA's mandate, right?
Objection.
I'm sorry, Mr. Maddox, I only heard part of what you said.
Objection. It's the very same thing. He is falsely characterizing things that are not equivalent.
Objection sustained. Rephrase your question.
Ms. Barrett, have any city employees been injured by the vaccine?
I'm not aware of any.
Do you require employees to report to you if they're injured by the vaccine or to report to the city?
Employees can report to Employee Health Services for medical reasons.
Okay. Is the city tracking vaccine injuries amongst employees?
Objection asked and answered. We've been over this.
No, I had earlier asked her if they track COVID cases. Right now I'm asking if they're tracking vaccine injuries.
Well, she said there weren't any that she was aware of, so you can't track something that
And you know what?
that it exists.
I apologize. I did not catch that distinction in his question. I withdraw my objection.
So is there a system in place to record vaccine injuries, Ms. Barrett?
There's not. We have limited resources. We don't have the resources of Buncombe County Health Department. We don't have the resources to track a novel coronavirus. This is a new virus. This is something completely new for employers, certainly for the city. We don't have the resources to track it. And frankly, if I asked HR staff to do something like that, that would present a risk, open up an area of risk for us. So no, we are not tracking.
How does the city enforce the testing requirement? Are there employees that receive tests on a weekly basis?
There are employees who review, again, this is going through employee health. So employees are required to, if they are not vaccinated, they're required to upload weekly evidence of a negative test. And when an employee does not comply with that, then HR is notified.
And how many tests are they having to review each week?
I don't have that number in front of me.
How many, is it a full-time job for someone or just part of their job to review these tests?
It's part of a job.
Do you have any idea how long it takes?
Maybe a couple of hours on Monday.
Okay. And how long do you think it would take to ask city employees to notify the city if they've had a vaccine injury?
I can't speak to that.
So the city recommends for every eligible employee to get vaccinated, but the city is not tracking whether any of those people are injured by the vaccine.
To my knowledge, there has not been any report of any injury.
Are you saying there have not been any or that you're not aware of any?
To my knowledge, there have not been any reported.
Would you be surprised to learn that there were vaccine-related injuries among city employees?
That would be new information.
Would that be helpful information in reviewing your policy?
It would be.
Is there any compensation system in place for employees who are injured by the vaccine?
I'm not able to speak to that.
Would workers' comp pay for wages if someone misses work from a vaccine-related injury?
Objection, that's so far outside her area of expertise.
Okay, I would sustain that objection.
HR is intimately familiar with workers' compensation claims. Ms. Barrett, are you familiar with workers' compensation?
Counsel, Ms. Barrett, if you feel comfortable or believe that you have the necessary knowledge, you may answer the question.
I can answer by letting you know that workers' comp is not under HR at the city of Asheville. It's handled by a different department.
Is there anything the city of Asheville has set up to compensate people if they've been injured by the vaccine?
I can't speak to that.
Let me finish up real quick. Just a few questions, just to make sure I understand your testimony, Ms. Barrett. And again, the city cannot give any data on whether this policy is actually effective or not. Is that accurate?
We have not been tracking cases, so no, we cannot provide data that you're asking for.
And the policy requires only unvaccinated people to test every week, even though you've acknowledged that vaccinated people can spread COVID.
Correct.
And this policy, there's no guidepost as to when this policy will end.
The policy is in place just like any other policy until the city manager determines and need to revoke the policy.
And the policy you testified was based on the science that vaccines prevent the spread of COVID, right?
Policy is based on guidance from CDC, OSHA, Buncombe County, North Carolina Department of Health and Human Services.
And that guidance is that, as you understand it, is that vaccines stop the spread of COVID.
That vaccines have a positive impact on reducing and decreasing the spread of COVID.
Okay, but you and Ms. Saunders are not able to tell us how much it reduces COVID by.
I can't tell you that.
And you don't even know if any vaccinated employees have tested positive for COVID ever, do you?
I'm not aware because I don't have that information.
Do you know any city employees who are vaccinated who got COVID?
I do know of employees who have gotten COVID, but I don't know their vaccination status directly.
And your policy does not account for the fact that different workers have a different susceptibility to COVID?
No.
Okay, those are all my questions.
Thank you. Mr. Maddox, do you have any redirect?
Just very briefly. Ms. Barrett, you're familiar with the city of Asheville's workforce?
Yes,
You're familiar with the makeup of that workforce?
I am.
And on the whole, would you say that that workforce is reflective of the community at large?
I would.
So, did you hear Ms. Saunders testify to provide testimony about the relative rates of hospitalization and infection between vaccinated people and unvaccinated people?
Yes, I did.
And do you recall Ms. Saunders reporting that unvaccinated people were more likely to become infected with COVID?
I did.
And that was compared to unvaccinated people?
Yes.
And is it reasonable to assume that those numbers would be consistent among the city's population as well?
It would be reasonable.
Objection. There's no basis for that.
That the city's workforce is, on the whole, reflective of the community. Is it fair to extrapolate the data that Ms. Saunders provided to the community to the city of Asheville's workforce?
Objection.
And what's the basis?
That is, first of all, she's not an expert witness. That is pure speculation to testify on extrapolating data from one set of a population to a larger set of the population. That's the same kind of speculation we've seen this policy is based on.
I'm going to sustain that objection, Mr. Maddox.
Very well, I'll withdraw it. Ms. Barrett, are all city policies perfect?
No,
Is there always room for improvement?
absolutely.
Is there a requirement that you are aware of that city policies be perfect?
No, I'm not aware of any requirement. And actually, one of the values of the city is continuous improvement. And that is certainly something that we try to do, is continue to improve as we have new information.
When the city is creating policies like this, does it try to balance various interests?
It does, absolutely.
Was it forced to do that in this situation as well?
Yes.
On the whole, are you satisfied with where the city came down on this policy?
I'm as satisfied as I can be.
Now, we heard a whole lot of testimony about mandates and OSHA. To the best of your knowledge, OSHA still recommends, does the OSHA still recommend that cities implement policies like this?
Yes, it does.
To the best of your knowledge, does the North Carolina Department of Health and Human Services recommend that employers put in place policies like this?
Yes.
To the best of your knowledge, does the CDC say that vaccination reduces the rate of infection among a population?
Yes.
To the best of your knowledge, does the CDC recommend that employers consider putting in place policies like this?
Yes.
I have no further questions.
Thank you, Mr. Maddox. Mr. Denton, do you have anything further?
Yeah, Ms. Barrett, you said you're satisfied with this policy. What is that satisfaction based on?
It's based on the fact that we were able to put a policy in place that meets some middle ground, that follows the guidance that we've received from multiple medical and health organizations.
Are you satisfied with the effectiveness of the policy?
To the extent that we have not seen huge increases in COVID among our population, yes.
And that extent is based on your own anecdotal evidence, right?
It's based on my anecdotal evidence as well as the information that's been provided by the medical providers at our employee health center.
Is the ongoing evaluation of this policy based on anecdotal evidence?
As we have throughout this entire pandemic, we have based our decisions and we have looked for guidance from trusted medical and health care providers, organizations like CDC, North Carolina State Department of Health and Human Services, and Buncombe County.
Well, this is the last question. I just want to make sure we're avoiding misinformation here, because I want to make sure that everything is based on reliable data, reliable sources. So, if I'm unvaccinated and I've never gotten COVID, I'm not going to go around and say, hey, see, don't get vaccinated, you'll never get COVID. That would be anecdotal. So your anecdotal observation among city employees, that's really not a good basis for whether or not you keep this policy going, is it?
Is it a perfect measure? No. If we had more resources and could do more thorough review, that would be preferable. But we're working within limited resources.
So you're saying you cannot track vaccinated and unvaccinated COVID cases because you don't have enough resources?
Yes, that's what I'm saying.
Okay, no further questions.
Anything further, Mr. Maddox?
No, Madam Chairman.
Mr. Denton?
Nope.
Mr. Maddox, do you have other witnesses?
No, ma'am. I think this would be time for the board to ask questions they might have.
Oh, that's correct. I'm sorry. Okay.
It's been a long day, I understand.
If the attorneys have nothing further at this time, then we will start. If the board has members, has questions, we do have members. Mr. Escovitz. Mr. Escovitz, do you have questions?
No questions at this time.
Thank you. Mr. Hahn, do you have questions?
None at this time.
Thank you. Mr. Devereaux.
Yes, one question, and I may have missed it, Ms. Barrett, but there's a lot of questions and answers about about infection rates, infection instances before and after the policy was implemented. My question is about vaccination rates before and after the policy was implemented. Do you have any data on that, whether the policy caused the number of people to get vaccinated to go up?
I don't have the specific numbers in front of me, but I can say that yes, once the policy was put in place, we did see an increase in the number of vaccinated employees.
Okay. And one other question. I know anytime there's a new policy put into place, even if it's not controversial, you probably get a reaction from employees, some that are very supportive, some that push back. Could you just kind of characterize how this policy was received, based on what you received in terms of your position as HR director from the employees? Just could you kind of characterize it?
Absolutely. And I heard directly from some employees who thought we hadn't done enough with the policy, and heard from other employees who thought we had done too much. So like a lot of policies, there were reactions across the board. But for the most part, most employees have followed the policy without real question.
Thank you.
Thank you, Mr. Devereaux. Mr. Webb, do you have any questions?
I do not.
Thank you. Mr. Eskovitz?
Yes, one question. Mr. Denton talked about natural immunity a number of times. And I have to ask it, our HR director, does your department have any data that compares the contraction of COVID-19 among individuals who had not been vaccinated versus those who have? Have you seen any CDC data on that?
I have not looked for that data, so I can't speak to that.
Okay. Thank you.
Anything further from any other board members?
Just thought of one more question if I can. Ms. Barrett, are you aware of any City of Asheville employees that have actually died of COVID-19?
Yes.
And do you know what the vaccination status was of any of those individuals?
I don't.
Thank you.
Any other board members have questions?
Yeah, I have one. I'm going to follow up on Mr. Devereaux. Do you know how many employees have died of COVID?
I know, and actually, Mr. Devereaux, the one employee I'm thinking of actually died prior to vaccines being available. So kind of outside the scope of what we're looking at. And Mr. Webb, I would hesitate to give you an accurate number, but I want to say it's less than 3.
Anything further, Mr. Ware? Any other board members have questions? Okay, I don't have any questions. Based on the board questions, do either attorneys have anything further?
I do not.
Okay. Thank you. Well, if we have, and now that I allowed the board to ask questions, this is their right. Mr. Maddox, do you have any other witnesses?
No, ma'am, we're content to rest here.
Okay. Well, I think at this time, the board will go into closed session. I am not the tech person, so somebody who is, I believe we'll need to go into a breakout room.
Yes.
We'll need to, let's take care of the motion and then we'll figure out the room.
Oh, that's true.
We will.
Well, entertain a motion to go into closed session.
It'll need to cite, you can just do it by, so moved. Need to cite GS 143-318.1183 to consult with an attorney employed or retained by the public body in order to preserve the attorney-client privilege.
We'll entertain a motion.
So moved.
Second, Alan Eskovitz.
It's been moved by Mr. Devereaux, seconded by Mr. Eskovitz, that we go into closed session with counsel pursuant to the applicable statute. Board members in favor, Mr. Webb.
Aye.
Mr. Hahn.
Aye.
Mr. Eskovitz.
Aye.
Mr. Devereaux.
Aye.
And I vote aye. So that would be a unanimous vote. And now to the tech, which I'm not good at. If someone could set up a breakout room for the board members.
Madam Chair, could I ask one issue of housekeeping? We are set to resume at 9 o'clock tomorrow morning.
So, and I want to be careful that we're clear here. Let us have a brief closed session, but we're not adjourning. Whatever it takes to keep this meeting should remain live while we have a minute to consult.
Yes, we're not adjourning, just the board is going into closed session. So we would ask everyone to take a break if you need it, but don't go too very far.
Thank you.
All right. And Madam Chair, I think I have established a breakout room for just the members of the board. So there should be Mr. Eskovitz, Mr. Webb, Mr. Devereaux, Mr. Hahn, and Campbell Shatley, which encompasses the attorney and Ms. Goins. So I'm going to open that room now. So you all will actually exit this call and go into a separate. So just.
And so Shannon, do I just click the link that we had for today to come back into, we'll just click on that link to come back into this meeting, right?
Yes, I think that should work.
Okay, we can do that.
Okay. And I will be standing by. So if you have any technical issues, just let me know.
Thank you.
All right. And you may have to actually click on it to join the session.
Yeah, so it looks like. I'm just gonna hand this over to you,
Okay.
Carol, to read.
We will see if everybody back. We'll give everybody a couple minutes to make sure. Let's see, all the board members, the city, 1, 2, 3, 4. And are we still on live?
Yes, we're still on live.
Thank you.
Motion to come back into open session.
It looks like everybody is back. If you're not here, raise your hand. I will entertain a motion from a board member to come out of closed session and go back into the main session.
So moved.
It's been moved. Is there a second?
Second.
Been moved and seconded. I'm sorry, I did miss who moved.
Either Alan or me, I'm not sure which one.
Okay, Mr. Webb moved and I think Mr. Escovitz seconded that we come out of closed session. All in favor, Mr. Webb,
Aye.
Mr. Devereaux,
Aye.
Mr. Hahn,
Aye.
Mr. Escovitz. You're on mute, but it looked like you said aye.
Aye.
And I vote aye. So we are out of closed session and we do have the following to read. Everybody is ready to move forward. Having heard the opening statements of the parties, the testimony and cross-examination of Ms. Sanders and Ms. Barrett, and after deliberation on the matter, the Civil Service Board for the City of Asheville finds as follows. Pursuant to the Civil Service Act, this board is charged with, among other things, determining the justification of employee dismissals with proposing substantive rules for hearings to come before the board. Number 2, dismissal due to policy violations may be unjustified in certain circumstances. Number 3, nevertheless, the determination of justification does not require the board to sit in judgment of the policies themselves. Number 4, this board will not invalidate a city policy on the basis of its own judgment, particularly as it is subject as to subjects that are based on public health authorities' information. Number 5, in this case, the city has carried its burden of proving justification of these employees' dismissal, and therefore this matter is dismissed. Is there a motion to accept that by the board?
I support the motion.
Mr. Esper, it says moved acceptance. Is there a second?
Second.
Mr. Devereaux has second. All in favor, Mr. Hahn?
Aye.
Mr. Devereaux?
Aye.
Mr. Webb?
Aye.
Mr. Escovitz?
Aye.
And I'm vote aye. Our attorney will have the written order out within 10 working days from today's date, as is required by the Civil Service Act. Is there anything further for today that needs to come in front of the board? Mr. Maddox?
No, Madam Chairman.
Mr. Denton?
Yes, may I be heard, Madam Chair?
Sure.
Was there a motion to dismiss this matter made?
Yes.
Okay.
Yes, we just read it.
Who made the motion to dismiss the matter?
It was made sua sponte.
So I was unaware. I'm looking at the Civil Service Act, and I'm not aware of a rule of procedure that allows a matter to be dismissed before my clients can present witnesses or evidence.
You're free to appeal this to Superior Court.
Well, hold on. I'm not asking if I can appeal it. I'm asking what element of the Civil Service Act you all are relying upon to dismiss the matter before I present evidence.
The burden is on the city to provide justification, and the Civil Service Board just found that burden has been carried, and it will not find differently based on any forecast of any evidence that you've made.
I understand that, and I'm asking what rule of procedure the board is relying upon to make that determination.
You mean the statute number within the Civil Service Act?
Yeah, I mean, where does it say that you can move to dismiss or there can be a motion to dismiss? I mean, we're not following the rules of civil procedure here, so I'm confused as to what authority the board has to dismiss.
There's not a prescribed rule of procedure for the board to follow. It has plenary control over its procedure.
So here's my other concern. When I appeal to Superior Court, I have to show Superior Court that we went through due process and I was afforded a hearing for my clients, and that after the hearing, the board made a determination. I don't think my clients have been afforded a hearing because they've not been allowed to present any evidence.
Well, you're welcome to disagree with that, but the way that the Civil Service Act conceives of an employee hearing is that the city carries the burden of proving justification. And in the opinion of this board, there is no evidence that you are going to have on offer that will result in them essentially invalidating a city policy.
Well, I understand the board's position, and I'm not saying I disagree with it. My concern is that I don't see any rules of procedure that allow the board to dismiss it before I present my evidence.
In the absence of a prescribed rule, they can make a sua sponte motion and rule however they see fit. And
So the board has the authority to rule at any time, however they want, before the end of all the evidence?
It is the conclusion of the city's evidence, and it was sufficient in the opinion of this board to conclude the matter.
Well, I'm concerned that when I go to the Superior Court, that a judge is going to say, we were not afforded a full hearing, and we'll have to come back here and do this.
Your hearing in Superior Court is de novo.
Trial de novo.
No, I understand that. My point is that I have to prove that we went through this process in order to get to Superior Court.
We've been here all day.
And we have not been allowed
to. Order has been, will be entered.
And my clients have not been afforded a full hearing because they have not been allowed to present evidence or call witnesses.
Well, so noted for the record.
Thank you for your time.
Anything else to come before the board? Hearing nothing, I'll entertain a motion to adjourn with my thanks for everybody's time today.
So moved.
It's been moved that we adjourn. Is there a second?
Second.
Mr. Escovitz, second. Mr. Hahn, you're on mute, but it looked like you said aye.
Aye.
Mr. Escovitz?
Aye.
Mr. Webb?
Aye.
Mr. Devereaux?
Aye.
I vote aye. Thank you, everyone, for all of your time. Have a great evening.
Thank you.